29-20, the Humboldt County Board of Supervisors meetings are being held virtually. You can participate via the Zoom call-in phone number, which is located on your screen and on the front of the agenda. And with that, Ryan, will you please do a roll call?
Thank you, Chair. Supervisor Bohn?
Yep.
Supervisor Bushnell?
Here.
Supervisor Bass?
Here.
Supervisor Wilson?
Yes.
And Supervisor Madrone, I don't see here, but Supervisor Madrone.
Oh, he's connecting now. I think that counts as a here.
Yep, here.
Okay, all righty.
All present.
Thank you very much. And so we will move on to the flag salute, and Ryan does have the flag ready to go. So, right, Ryan? All right. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, liberty and justice for all. My brain just kind of went dry there. Help me out here. Okay. All right. That's close. My brain totally just like died right in the very end. Sorry. It must be a Tuesday because it's starting out like going, heaven's sakes. All right. So how this meeting will run, at least how I hope it's going to run. For those of you who want to call in and make comment on an item, once you do call in, press *9 at the beginning of the item and that you're interested in talking about. When it's your turn, you will be called upon and press *6 to unmute yourself. And we have a 3-minute time rule, and it's a strict 3-minute time rule because everyone should have the same amount of time to talk to the board. When you hit the 2.5-minute mark, you're going to hear this sound. And that's telling you that you have 30 seconds to wrap up. And at that point, your time is over. I think it's important for people to have breaks, and I'm going to try to take one between 10:30 and 11. It depends where we are on the agenda, but we'll certainly give that an effort. So with that, I think we can move on, and I'd like to ask our CAO Nielsen if there's any modifications to the agenda.
Good morning, Chair Bass. There are no modifications to the agenda today.
Right, is there a motion to approve the consent calendar?
I move to approve the consent calendar.
Is there a second? All right, thank you. So we have a motion and a second. Let's go out to see. We have some attendees. At this moment, I do not see any hands up in the attendee queue to make public comment. Ryan, do you see anything?
Chair, I do not see any hands up for public comment either.
All right. Well, with that, we'll return to the board. We do have a motion. Does anyone have any comments or before we take the vote?
I just want to thank the board for supporting Assembly Bill 223, which increases fines, or actually creates fines for the possession of Dudleya, the succulent that was poached here on the North Coast. Quite frankly, that those arrests were made not necessarily because of the poaching of the plant itself, but it was done when those things were being sent internationally and illegally from that perspective. And so this is the first time California will have these types of poaching fines for plants, which is we see them for animals quite a bit, but this will be the first time that we have it for plants. So anyways, I appreciate the support for that bill.
And I'd have to say, I was surprised. I had no idea that plants could be so valuable. And I kill all plants, so good thing I don't have one. Any other supervisors want to make a comment on any of the consent items? All right, seeing none. Ryan, can you do a roll call vote, please?
Yes, Chair. Thank you. Supervisor Madrone?
Yes.
Supervisor Bushnell?
Yes.
Supervisor Wilson?
Yes.
Supervisor Bohn?
Yep.
And Supervisor Bass?
Yes.
Thank you. Passes 5-0.
All right, so we're moving on to the public comment on items that are not on the agenda. Anyone who calls in will have their 3 minutes to raise their issue. The board will not discuss it and no action will be taken. So let's see if we have anyone out there I do not see any hands raised. Again, if you want to make public comment, press *9. Okay, I do not see anyone wishing to address us on items not on the agenda. So with that, we will move on to our special presentation, which is our every 2-week COVID update. And I'll turn this over to Dr. Hoffman and the team. Welcome.
Thank you, Chairwoman Bass, and thank you, supervisors. So start the update this week with the epidemiology, where we've been over the last couple of weeks. Case rates have continued to remain stable in the red tier, around 6 to 7 per 100,000, without any clear downward trend over the last month. We've yet to accumulate any weeks in the lower orange tier metric. So we probably will be in for another couple of weeks, at least 2 or more weeks in the red tier, given the state of where the numbers are at currently. I think though, with continued focus on slow reopening, we should be on track to meet orange tier metrics at sometime in April, as long as we remain cautious and the current track that we're on. We recently removed the ICU metric from the dashboard. We're really in a different place in the pandemic right now, so we don't feel that that information is needed any longer. Despite the cases continue to go down, though, we still have seen deaths in the past few weeks from COVID-19, and some people in their 50s have died. Our hearts go out to the families, friends, and caregivers of all the loved ones who've been lost to COVID-19. Testing rates had seen a bit of a dip over the past month, but have come back up in the past few weeks. So we're encouraged by that, and we want to continue to encourage everyone to keep getting tested, and especially as we open up society more in the coming months, it's really important that we keep tabs on the virus. So there are still many options for testing around the community, including private doctor's offices. The OptumServe site still is running 7 days a week. And if you have questions about where to get testing, you can always call the JIC at 441-5000. As far as vaccines, we have been seeing a slight increase in the amount of vaccine coming to Humboldt over the past few weeks, with the average number of vaccines now over 5,000 for the last 2 weeks. This is in line with what we had been hearing the federal government had been promising, and we're expecting that this availability of an increase will continue through April into May, and could even grow larger as supply of the new vaccine Johnson & Johnson becomes larger, and efforts to increase the supply of both Pfizer and Madrone are underway through both of those companies. So with the expansion that the federal government has suggested, the supply could allow as soon as May for every American who would want the vaccine to be able to get it. So basically, that it could be as soon as May that there's no more line, and people will not have to wait any longer for the vaccine. So that's very encouraging. We're hopeful that that could come to fruition. But currently there is still limited supply compared to the demand and the eligibility tiers. So currently vaccination in Humboldt is open for all phase 1A, phase 1B, along with those who are 65 years and older, and the 16 to 64 group with qualifying medical conditions. However, it's very important to recognize that due to limited supply of the vaccine, not all of these groups are going to be able to get vaccinated immediately. So we continue to ask for patience as we reach out to those and try to move people through the line as the vaccine supply allows. Our public health clinics have started to target and outreach in the food and agriculture sector as we have enough vaccine to do so. Reaching out to some of the larger businesses in this sector that have had higher risk and have seen outbreaks. We will continue to do that outreach in the coming weeks through the food and agriculture industry, with larger clinics open more broadly as the vaccine supply allows. And we hope that in April, starting with My Turn, the state-based program for online booking, that we'll be able to open up to the 16 to 64 age group with qualifying medical conditions and all of the rest of the food and agriculture industry in Humboldt County. So this will all be done through self-attestation form that's part of My Turn and allows patients to self-identify as having one of those medical conditions or being in an industry that is open for vaccination, trying to break down some of the barriers that have existed for many of the patients, especially with the medical conditions. Many patients in Humboldt County might not have access to a reliable doctor locally, and so that self-attestation should allow them to have better access to the vaccine. And I want to also remind everyone that we still are using the interest list on the Humboldt County Health Alert website to invite people to public health clinics. So please, if you're interested in getting the vaccine and you haven't been able to get an appointment yet and you're in an eligible group, please go on the interest list and fill that out. Other efforts around vaccination, statewide, there's been an effort to reach the vaccination in the lowest quartile Healthy Places Index, or HPI. We met the first goal of getting to 2 million statewide in those zip codes, and the next goal is to get to 4 million. And so Humboldt County is working with providers and through our public health clinics in attempts to reach out to this population in those zip codes, so we can get to that goal faster. And that's happening through outreach to clinics who work in those specific zip codes, who work with the specific populations and worker groups who work and reside in those zip codes, as well as outreach to groups who work with homeless and those who work with high-risk mental health conditions. So when California reaches that goal of 4 million in the lowest, 4 million vaccines in the lowest quartile HPI, the orange tier cutoff will move from 4 per 100,000 to 6 per 100,000. And this will very likely allow us to get into the orange tier metrics sooner than if we don't meet that goal. So it's very important for us to focus on that at this point so we can help California get to that goal, get to orange tier faster, and allow for more reopening. Please remember that there are currently no recommendations for altering your behavior after getting a vaccine in regards to masking, distancing, and mixing of households. We're awaiting CDPH to update and to address the CDC statements about mixing households of vaccinated persons, but we've yet to see that, and I would expect to have that from CDPH in the next 2 weeks to present, hopefully at the next board meeting. Lots of other things around reopening have been going on across the state. We've been on a roller coaster of youth sports guidance over the past month. All of us were very excited about getting kids back to activities, helping their mental and physical health while balancing their safety along with the safety of their families and the safety of society. In mid-February, CDPH gave guidance on reopening of youth sports and stated that youth sports could be attended by no spectators, but only age-appropriate supervision. CDPH did not define the terms or give limits on who or how many that was. Humboldt and Del Norte continue to ask for guidance from the state and a definition on what this meant, emphasizing that we wanted a number from the state to share with schools and the leagues so that they could be clear with what the intent of age-appropriate supervision was. When the number finally came, days just before the first games were to be played, many counties, including our own, had already come up with their own determination of what was safe and allowed. In Humboldt and Del Norte, we had determined that 2 adults from the athlete's household would be appropriate to encompass all situations that might arise. We felt a single member of a household might not fit every single situation. We had also discussed allowing cheerleading to occur not on the sidelines, but as a separate competition that would keep all teams from mingling. So when CDPH came out at the last minute with a ban on sideline cheer, we tried to emphasize that our recommendation would still allow for cheer between breaks and halftime. But it was hard to make sense with such mixed messages from the state and local health authorities. Notably, the families, students, athletes, administrators were all frustrated and confused by the mixed and constantly changing messages. Late Friday, with CDPH rescinding their ban on cheer and bans at sporting events, We hope the air is going to clear going forward, and we look forward to more specific guidance on sporting events that should allow for spectators, not only in the age-appropriate supervision as we move into April. Humboldt County Public Health will continue to work with HDNL, HCOE, and the schools to provide an environment that is safe for our student athletes and their families as we see further opening of society in the coming weeks, and to safely start to increase the size of events for both youth sports and beyond. With spring here and the vaccination in full swing, many are asking about travel. We want to remind everyone that the CDC and CDPH both continue to recommend against any non-essential travel at this time. CDPH recommends to stay within 120 miles of home. There are not travel recommendations that apply specifically to vaccinated persons. We all must follow the same travel guidance at this time. We hope to see new travel recommendations from CDC and CDPH coming soon. And as we get more vaccine out into the community, likely at some point in April, I would assume we'll start to see some of those changes to travel guidance across the country and across California. Other major announcements that came last week, CDC made a major change to its school distancing guidance late last week by recommending that K through 12 schools could reduce to 3-foot distancing in classrooms. This only applies to students, student-to-student distancing while in the classroom, not to the adults in the classroom or to students who are not seated at a desk in the classroom, nor does it apply to any other setting outside of a K through 12 school. So while the 3-foot guidance is not new, we had been using 3-foot in Humboldt County early on for some of the reopening back in the fall. There had been considerable debate as to the best approach, and 6 feet was and is still now considered to be the safest and best option for preventing the spread of COVID-19 in schools. However, the current most applicable science does suggest that K through 12 schools setting 3 feet can be done safe when it's done correctly. CDPH adopted the 3-foot rule for K through 12 over the weekend, and we will be working this week with local K through 12 schools to discuss the implications for the schools that are open currently and the ones that are working to reopen now. If they want to implement less spacing or stick with the stronger adherence to more distancing. But I do want to emphasize that with the 3-foot spacing, it's really important that we have other measures in place, like adherence to masking, use of other barriers, and distancing in other settings outside of the classroom. So as we move into the next phase of this pandemic, we're working backwards from where we came. First, we shut down everything last March as we were trying to get a hold of the virus, figure out how quickly it spread, what were the settings that were the most risky, and also the need to protect the hospital system that could easily be overwhelmed with a fast-spreading virus that was so clear in the early days. So we slowly opened up over the summer and fall, only to have to clamp back down again during the winter surge months that became the most deadly months yet in the pandemic for California. And now here we are unwinding that latest shutdown again with another powerful tool in our tool belt of vaccination. That means we have a lot of unknowns, which is how quickly can we open back up given the level of vaccination immunity and natural immunity in the community. We know based on the recent case counts, ongoing hospitalization, and recent deaths that we still need to be cautious. We need to be cautious about opening sports, travel, schools, businesses, events. We've seen lots of changes around all of those in the past weeks because we are coming to terms with what we can tolerate as a society and what is safe for society. So when we see contradictions, quick changes in policy stance, lawsuits that change the course of actions, we need to realize that these are difficult societal decisions that don't always have a clear answer. But we are all working hard to balance the best for the safety of those who are the most vulnerable to COVID-19 and all of society who need to get back to normal after a very long year of the pandemic. Thank you.
Right. I know I have probably like 7 questions, but I'll let the others go first. But I do want to ask if Michelle or the sheriff have anything they wanted to add at this time.
Not right now.
Not right now. Sheriff?
I just have one quick thing. There was an inquiry about how many counties still have an emergency operations center rolling and managing this emergency. And we have about 55. 55 have, out of the 58 counties, still have an active emergency operations center. The other 3 counties have a DOC/EOC, and all have a local emergency still in place. So we're all dealing with this and managing it, though differently throughout the state. We still have emergency operations centers rolling, and that's important because of the outreach to Cal OES to seek state and federal reimbursement for all of the costs that have been incurred from managing this emergency. So we're still looking at that, but we're looking at ways of demobilizing and certain aspects of the EOC and getting back to normal, because we have a lot of our county employees that are tied to the EOC that are managing their other jobs while they're managing the EOC. So there's a lot of duties and responsibilities that are shared in our EOC and especially our JIC, and as well as our public health department realizes that with all of the employees that they are utilizing to manage on both sides of the house. Just want to let the board know that, and we're still definitely active and still doing what we can to manage this emergency, but also looking at long-term, demobilizing how we can transition back to normal life.
All right, thank you, Sheriff. So any supervisors have questions? Yes, Rex? Supervisor Bohn?
Yeah, are we sure we're gonna use the Blue Shield option? Because it's like with the flaws and everything else. I know quite a few counties are opting out because they're having quite a few issues, and it's a pretty bureaucratic thing. And if we start getting 5,000 a week, plus what we've already done, and then I don't know, do we advertise that? I know a lot of the agricultural workers are going to CVS, and some of the private, I guess that would be the outliers. They wouldn't be partners. They would be on their own standalone federal partners. Do we tell them to try to use that? Because I know a few of the dairies and stuff have had to go there because we weren't able to provide for those ag workers and agricultural workers as a whole. So, or do we give people that option and tell them how to? The whole thing, at the end of the day, it's not who gives them the shot. It's the idea that they get the shot. I know we can't take credit for those numbers, but I was just wondering.
So your first question, Supervisor Bohn, about the Blue Shield TPA, we do not have a choice in this matter. This is a directive by the state. So we will continue to be meeting with Blue Shield. We have a meeting today to work on the transition plan. So that will be going into place over the next few weeks. I think the question at hand is, what will that look like? And is it going to look exactly the same in every county? And so that's where we're not sure yet. They do seem very open to working with each county to meet the needs of that county. As far as eligibility, currently eligibility is open to all of those groups that I mentioned. But the number of people in all of those groups far exceeds the number of vaccines that are available. So people have many different options. If they have a physician's office that is vaccinating, they might very likely get reached out to by that office to schedule them to come in for a vaccine. Mostly that's in the age categories though, and potentially in the 16 to 64 with underlying medical conditions, because those are things that the doctor's office would know about easily and have at hand. Occupation, however, is not an easy thing for a physician's office to verify or know. So, we have been holding the clinics for occupations and reaching out to different sectors, but certainly they are also eligible to go to any of the pharmacy partnerships that are vaccinating in the county as well. And some of those are, do have ability to book online. So there's no one way that someone can get a vaccine in Humboldt.
No, Thank you. I was just wondering if we're advertising, not advertising, but advocating. If we can't take care of you, here is the number for some of the not medical providers, but pharmacy providers that we aren't affiliated with. They're on the federal contract. But
Yeah.
are we pushing that? I couldn't see it on our website.
Oh
It's
yeah,
every-
there are links on the website. The
Okay.
Dick put them up a few weeks ago.
They're also in every news release we put out every day for the case count. We have the links to Safeway and CVS and information
good,
around Rite Aid. I wanted to let you know, Supervisor Bohn, we did a clinic on Friday for the dairymen and the employees, and huge turnout and great feedback from Melissa from Western United Dairymen's Association. And so we have actually been vaccinating the folks in the
No. I know that. I know some went to the CVS before, but I appreciate that Friday. Melissa said it went really good, and I was glad you guys were I was able to get you guys hooked up, because she's a wealth of knowledge for the dairy industry.
Yeah, and I think, the way to see this is these clinics, we'll call them closed clinics, allow better access for certain groups that we want to reach and target. So obviously everyone can go try to get an appointment anywhere, but we want to preserve certain blocks of clinic appointments for these higher risk groups that are important to do outreach to. So that's where we're at. We're doing that over the coming weeks, and we'll continue that outreach. And at the same time, we hope that with the increased supply, that people will be able to go to more through their doctor or through CVS or Safeway, Rite Aid, the different pharmacies that are doing vaccination in our community.
All right. Any other questions at the moment before I have mine? All right. I'm going to launch into a few because I don't see any hands up. So you've covered a few. I seriously had a list. Sorry about this. But okay, so like you talked about, Supervisor Bohn brought up the Blue Shield, and I know that it's a challenge, and for sure. What happens when providers opt out of it? Because I believe we got a letter, at least from one, that said we are not doing it. So how does that work if you've got providers in the community that are choosing not to do that? And I know I was on calls with the state, and I think you're right. The state wants us to do it, and I'm just curious what happens if these providers. Can they just opt out even if we go with that plan? That's my first.
I don't think there's any way to force any provider to continue vaccinating. Obviously, we want to work with them. Blue Shield wants to work with them. My understanding is Blue Shield's offering incentives, to providers who continue to vaccinate. So there could be financial incentives. We don't know all of the details of that. We still haven't had all of the meetings with Blue Shield yet to get those kind of details. They promise us, though, if we need more capacity, that they will help build that capacity either by sending in teams, potentially things like Optum or other contracts that might be able to fill in those gaps, pharmacy contracts that could come in and fill in those gaps. So I think in the meantime, what we've been told is that they have a commitment to continue the network we have already built until we have something else in place.
Well, and I just think people are very reluctant because I know the state's trying to do the best they can, but it feels like the push me, pull you, take this back, do this, and I think people are aggravated. I wanted to ask about getting on wait lists, because I know some of the providers do have a wait list in case their clinics run, if people don't show up and they need to offload vaccine. It's perfectly fine for someone to get on the wait list that is not in the category, isn't it? Because it seems like they want to vaccinate their patients one way or the other versus throw it away. But I've had some people ask me, it's like, well, I don't fit the age criteria to get it, so I shouldn't be on the wait list. Yeah. And I'm going, that's not, I just wanted to get your take on that.
That's a great question, Supervisor Bass. I think, so we definitely want to encourage to try to first reach out through the open tiers of the open eligibility tiers. So age-based, sector-based, or 16 to 64 with a qualifying medical condition, because it's a very large group of people. But we've always said all along, if it's too much of a barrier to get through those, to get through to some of those people, you know, at the end of the day, the ultimate is that no vaccine goes to waste. So we certainly don't want to put up barriers that would create wastage of the vaccine.
And I appreciate that, because I was on my doctor's wait list. I mean, I did get on and I didn't think it would go anywhere. And let's just say there was a clinic and they had a huge number of no-shows. So they did a call, and I just, you know, I was amazed at the people that were all there besides myself. I mean, they were very young people. So I've been just encouraging people to if they have a provider that does have a wait list, to at least get their names on, because you don't know if all of a sudden they're going, we got 30 to get rid of and we only have like a half hour to do it. I just think it's worth a shot, you know, and whether you think it's going to happen or not, it's better to try. So I've been recommending that to people.
Yeah, and so public health maintains its own wait list as well, based on both the interest form and other groups that we've been working with who are in the eligibility tiers. And okay. So that's, I think just if you're interested, get on whatever list and get on.
Okay, no, that sounds good. And I just want to ask two more things, but I'll ask one and then I'll go to someone else. So you talk about travel, and I know the recommendation is not saying you cannot travel. And I do know many people who are traveling. And there are places I've been asked where people can get the appropriate test. I think it's like a GNAT. You can only go to certain places to travel to get this specific test apparently done. Do you have any information that we can share with people, or is that something I need to try to ferret out through other channels?
In terms of a test for travel?
If someone is, okay, people are flying. I don't know how to tell you, I'm not, but there are people that are. And, you know, I've had people saying, I have to have a specific test done per the state and have the results by the time I leave, or by the time the plane lands. And they were saying, but it's a specific test. Who does this test? And I think it's the GNAT, or I could look it up, but it's got, and you can answer that later. I just know people are calling me because people are making plans and they're wondering, you know, how to put the pieces together.
I would encourage anyone who is traveling for a specific reason to reach out to their airline and find out what the recommended travel advisories are. We're public health, because we are recommending against travel right now, and the current CEPH guidelines recommend that we all stay within 120 miles of home for non-essential travel. Obviously different if it's essential travel, and people who travel for work or who have to travel for some emergency or health related reason. I am not aware of those specific tests and where they could get them. It wouldn't be through public health though.
No, I understand that. All I want to say is people are traveling. I can't tell you the number of people that are in Mexico right now.
Obviously, we know that.
Wait, let me just finish this again. Okay. So I would just ask for future updates that we do. I know we were saying don't travel, but it's like, if people are going to, I'd like to at least make it easier. So I get it. We don't have to talk about more now, but I'm just going, I think a realistic way is at least to have that information available if people do, because I'd rather have them feel that we've been helpful and not have them find out they took the wrong test and they can't get on their plane and they get turned. I don't know what happens to them, but that's all. I'm going to go to Supervisor Bushnell.
Well, if I could just make one last comment on that travel. Sure. I mean, we did see the largest travel day this weekend that the U.S. has seen since the beginning of the pandemic. So we understand people are traveling, but that obviously we're in a really early reopening of this. And I think that the message is clear from public health standpoint that we'd still encourage people not to travel for non-essential reasons.
Yeah, well, going to Vegas and Florida would never be on my list right now. Craziness. Supervisor Bushnell?
Thank you. And planes are packed, by the way. I didn't travel, but they are. So I just wanted to reach out to my community and my district and say thank you to Southern Humboldt Gerald Phelps Hospital. They had a very large batch of COVID-19 vaccines that they received this week, and through their social media, they put out if you are any age to get registered so that they could reach out to the Southern Humboldt area to vaccinate anybody that wanted to. And I would encourage in the general public to look at social media for the clinic updates, because that's where a lot of it's coming. Also, I received an email from the Gerald Phelps Community Hospital stating that they had gotten, a large batch of the vaccine and was opening up the eligibility to people that applied. So the information is out there, and why we're, Dr. Hoffman, you're saying you're not eligible if you're this age or this criteria. Other clinics are doing it, and so I just really want to encourage people to seek that information, even if you're 20 years old and you want to get the vaccine, because it's out there available in abundance at certain clinics. And I think it's really important that we say that. Well, I'm going to anyways. So thank you, and thank you, Dr. Hoffman and Michelle, Director Stevens, for your updates.
Yeah, and we definitely don't want to put up barriers. If there is vaccine going unused, we do want to try to reach out to the populations that are eligible first. But if those attempts are not meeting with getting those appointments filled, then we should open up eligibility further. And so we work very closely with all of the clinics and have an open line of communication with them, so they are very aware that they can always reach out to us and ask any questions.
Well, I think it's really important that we convey that, because that is not exactly what I got out of your information this morning. And so that's why I'm saying this. I saw this yesterday on social media and then got the email from my clinic. So I just really want to encourage people to seek the information. While we're stating, public health is stating this is the criteria, there is so much more availability out there if you want to get vaccinated.
Yeah, I think we're in a state of really, we're about to potentially turn the corner on the eligibility and the supply. And so it's always hard. This has been a tension throughout this whole vaccination effort of when to open up more widely, because we definitely don't want to slow down the line, but we want to try to get to the most vulnerable first. So especially, efforts in those zip codes that I was mentioning, the lowest quartile HPI, might have much looser eligibility to get it out more broadly, so we can meet that 4 million mark for the state, and then have the orange tier metric move, as well as the yellow tier metric also moves with that. So that is definitely our goal. But we know that there's still other places where 65-year-olds who have been waiting for months would still like to get a vaccine and haven't been able to. So it's a balance.
All right. Thank you. Any other questions from the quiet board? Supervisor Wilson?
Yeah, I just wanted to point out with regards to some of what we're talking about with, accessibility to what one might consider the leftover vaccines at the end of the day, which seem to be what people are accessing. I mean, part of that is proximity and flexibility, and also understanding the technology of communication to be noticed and be able to make yourself available in that space. So it's not just wanting. It really has a lot to do with like I said, the proximity, your privilege of space. There's a lot of things in there that make that accessible to folks. And so, and I'm not downplaying that. I think that's fine. What it just says to me, though, is that the efforts to actually get it out beyond, people who live within proximity of clinics and proximity of pharmacies in some of these places. We just got to work on that, which I know you guys are doing. And to Mr. Hoffman's point about a couple things with relationship to unrecommended travel. I'm not sure why the county would be, offering information about, how to access testing for unrecommended travel. But nonetheless, I guess, we do those sorts of things for other health issues. And the main thing is, there's so much anxiety around this. It's a whole new anxiety about who's getting vaccinated, how to get the vaccination. That's all going to lift quite a bit in May when these things really open up. So we really are in a transition. I'm really looking forward to when we don't even have to talk about the tiers of accessibility to the vaccination. That's just going to be really great. So moving forward, hopefully we'll get there sooner rather than later. Thanks for your hard work.
Any other questions? All right, well, I'll follow up on when Supervisor Wilson said, why would we want to help? I think the thing is, for me as a supervisor, when I get calls from people, they're going, whether I help them figure out where to get a test or not. So I'd rather be able to be armed with the information when asked the question, because it's happened more than once. And do I think they'll change their plan if I don't tell them? It's like, no, I'm not going to tell you. I'd like to rather be kind of helpful if that is what that's what they're doing. The main question I had that I will ask, and this is the end of my stuff. There's an article in the newspaper, last week where it said 20%, 1 in 5, people are vaccinated. And it had some information that kind of came out. It didn't make sense. And then it said, and we haven't received the Johnson & Johnson, which I know is not true. Can you kind of explain a little bit why the numbers, when you look on the site, shows us having a higher percentage, and from what we give out is a whole different thing. There's public health, and then there's our partners who we don't even know what they're getting, right? And so, but it's hard to explain that to people. And so maybe if you could just kind of quantify, there are these many people who, we can't give you, I feel like we can't give them accurate numbers, and it's not your fault. I think it's just the system is not made up in a way that we can sometimes give the public the information they really want, because I think we've done much better than 1 in 5, when you look at all the different partner agencies. Yeah, but that's just my my thought. I just find it frustrating when someone says, well, why are your numbers different? I'm going,
yeah, it is tough, Chairwoman Bass. There are a lot of different ways to look at this, and there's a lot of different data points, and this is part of why the state has put the Blue Shield contract into play, is to try to track everything better. So two points. One, Johnson & Johnson. We have received Johnson & Johnson. The county received a small allotment. St. Joseph's received a larger allotment and worked with us to get that out to the providers. So we've been giving that out over the last several weeks, and we expect more to come, hopefully, with the next shipment next week, as California is supposed to get more. But they haven't gotten very much since that first shipment 3 weeks ago. In regards to data, so our data that we're posting on the dashboard comes from the CARE registry, which is the California Immunization Registry. And that is a requirement that every provider who gives a COVID-19 vaccine put that information into that database. Of course, that wasn't happening uniformly across the state, which is part of why there were millions of missing doses across the state. We feel good about our local providers. I'm certain there are a few that have not been entered, but we didn't feel that it was anything systematic that was causing large data problems. So we felt confident in putting that data up on our website. So if you look at that data is pulled from the CARE registry, and we can see with that data who's gotten their first dose, who's gotten their second dose. And we do that by zip code residence, so we can make sure that they live here in Humboldt County. Now, some of those people might have been vaccinated outside of Humboldt. Maybe they traveled, or maybe they work outside of Humboldt. But those are Humboldt County residents who've been vaccinated. And we have also been looking at the individual provider level data, just to do some quality assurance checks and see that the where the vaccines have been going and getting registered in care. So all that information's in care, and that's what you see on the website. And I think, when you talk about how we present that data, when we talk about 1 in 5, that's of the entire population, right? But of current eligible population, that's only 16-year-olds and above. So it takes out, about 18 to 20% of the population when you take out those kids under age 16. So if you look at that metric based on last week's run, which we're putting up each Wednesday, so it'll go up tomorrow on the dashboard. As of last week, about 30% of eligible adults, 16 and older, had received at least one shot. And then, what do? Are we going to look at just those who've had one shot, or do we only report those who've had both their shots or complete vaccinations, which now includes people who had one of the Johnson & Johnson? Those are one and done, so they also count as a fully vaccinated person. So it is complicated, and that's why. But I think when we look at the metrics where we're at in Humboldt County, we are matching the state, if not doing a little better overall than the state.
Well, and you brought up the part about where it says like 30-some%, because that's what people are saying. Well, this doesn't make sense, and so perhaps that's something that the media can be a little more clear about, of what the 1 in 5 is based on. Anyway, it was interesting, and you answered the question, and I completely get that, so I appreciate it. Supervisor Bohn, and then we'll go to public comment, of which there are no hands yet.
And then last but not least, would this be a good time to mention the clinic up in Hoopaw this weekend that the Karuks, the Urocs, and the Hoopaws have put together, which is all encompassing all ages, not just for natives, but for everybody that lives on Highway 96, and pretty much encompassing all of Humboldt and part of Trinity on 299, all the way down to Johnson, all the way to past Soames Bar. So would that be a good time to mention that? Because I don't see that on our website, but those are one of our problem zip codes. And I think that would be a good idea to get that out as much as possible. I know they have a limited amount of vaccines, but I hope they go through every single one of them. So, but I think they've really stepped up, and I imagine that's with your partnership somehow. But are we putting that out on our? Because I can't find it. I just looked for it. I can't find it. But
well, they're an independent clinic, an independent sovereign
operating in Humboldt.
Really operating. Yeah. We haven't been working with them on the vaccination effort. They get their vaccine through the federal government, through IHS, Indian Health Services. So, we'd be happy to partner with them to get the word out. I don't even know if we need to partner with them. I just think I'm going to put it on my Facebook for whatever people I got, just to get the word out. Because at the end of the day, I don't care who does it. Mm-hmm. Just stick as many people as possible. Absolutely.
That's at the end of the day. We're spending way too much time figuring out how we're going to do it and who we're going to do. I think we should just be doing. But anyway.
Okay, and thank you for bringing that HOOPA item up, because I wanted to do that. Supervisor Madrone, did you have any questions or comments you'd like to share before public comment?
Well, I appreciate Supervisor Bohn bringing up the HOOPA efforts. The more media attention we can get on that, the better. And just thank you, everybody, for what you're doing. We're in the home stretch on this. I think as Supervisor Wilson, the narrative keeps changing in that we're now in the vaccination stage. And, in a year from now, we're going to be talking about whether we need boosters or other things. So these phases keep changing. And I just very much appreciate the efforts of public health and Dr. Hoffman and everybody out there doing what they can to try and get their vaccines, but also continue to maintain all the safety measures so that we can really get through this. So double down on that, folks. Keep the safety protocols going. That would be my message.
All right, thank you. Well, I will go to see if there's anyone who wishes to make public comment. And there are no hands up, so we will return to the board. And any last comments, Dr. Hoffman, Michelle? I mean, thank you for being here. And sorry to keep you so long, but there's a lot of information and really much appreciated.
It's been a big couple of weeks. I'll just say that. I think, all of us are feeling, as was mentioned, just the stress and the anxiety of this unwinding and coming out of this last, year of big changes. And we want to continue to ask for patience as we figure this out, figure out what's safest, not move too fast or too slow, but try to find a middle ground. And I think the last thing I would say is just, if you get a vaccine appointment, please take it, whatever vaccine it is. Again, every shot in the arm right now is a step closer to our goals of being able to open back up and feel confident in society again.
All right, well, thank you very much. And Supervisor Madrone, did you have your hand up?
Yeah, I just wanted to reinforce what Dr. Hoffman said. Make your appointments, and whatever vaccine is offered, take it. I took the Johnson & Johnson's, one and done, and no reactions whatsoever, and I'm grateful to have it. So I just encourage people. I know there's a lot of talk about the different efficacies, et cetera, but bottom line is get whatever shot's offered to you. It is a massive improvement over what you're currently sitting with, and the Johnson & Johnson was just fine. I'm doing well.
All right. Well, with that, we'll let you guys jump off, and thank you very much. And we'll move on to the next part on our agenda. Under matters initiated by board members, today's item comes from Supervisor Bohn regarding the long-term care ombudsman program, which, by the way, I think is one of the best programs in this county. So, Supervisor Bohn?
Well, and and this area one on aging and stuff is a big, this is the important program. And since I'm one of those aging people, not as old as some people on this board, but real close. So I think the presenter today is going to be, is it me? Who's presenting today on this?
That would be me, Leanne Langston. I
Thanks,
just don't know why I'm not showing up video wise. So
you haven't paid your fee.
I haven't paid. I have my camera on, so I don't know what I'm doing wrong in that respect. So,
well, Ryan, do you have any words of advice or technical?
There's if you hover over the bottom, there's a start and stop video, and that would be the only thing that I can see. There we go.
Ryan, you're amazing, I tell you. Welcome.
There's still a fee, Leanne.
Okay, just let me know what that is, and the check is in the mail. And Brian, thank you for your technical help.
All right.
Well, Leanne, please start your presentation.
Thank you very much. Thank you so much for letting me be a part of your forum today and for giving me the opportunity to share some information about the long-term care ombudsman program, which is a program through Area 1 Agency on Aging. I love having the opportunity to advocate for our senior community. I've been with the Ombudsman Volunteer. I am the Ombudsman Volunteer and Media Outreach Specialist. I've been with the Ombudsman program for over 2 years. My responsibilities include recruiting and training new volunteers, coordinating the volunteers' monthly activities, and doing media outreach. My goal today is to share information about the role of the long-term care ombudsman program, and hopefully each of you will share this information in our local community. The biggest thing is, what is an ombudsman? And a lot of people are confused about what an ombudsman actually does, what we are, what our duties are. The long-term care ombudsman program was created in the mid-1970s to advocate for the rights and needs of long-term care residents. We operate in all 50 states, and every state has an office of the state long-term care ombudsman to guide statewide efforts. In California, there are 35 local ombudsman programs that collectively cover all the counties in the state. Our mission is to advocate for the dignity, quality of life, and quality of care for all residents in long-term care facilities. Long-term care settings include 6 skilled nursing facilities, Humboldt and Del Norte counties, and 16 residential care facilities for the elderly. The 6 core elements of long-term care ombudsman programs is 1, receive, investigate, and resolve complaints. 2, ensure a regular presence at long-term care facilities. 3, address patterns of poor practice. 4, maximize community awareness and involvement. 5, influence public policy. And 6, ensure effective program administration. We are a federal and state mandated program. Our goal is to work on behalf of the resident and only with the resident's consent to make sure they receive the care they deserve and are entitled to. Additionally, we are mandated to investigate suspected reports of elder abuse, whether the abuse is physical, financial, sexual, or other forms of elder abuse, such as isolation and neglect. We serve residents in all facilities from Crescent City to Garberville. Most residents will not speak up due to either not knowing that they have rights or what their rights are, or for fear of repercussion or retaliation. So we can assist them in having a voice, or if need be, we can be their voice. We always try to encourage them to speak up for themselves, but if we don't want to, then we can step in. We ensure their privacy if they don't wish to give us consent or wish to use their name when addressing a concern. So for an example, if a resident has a concern or feels they're being treated unfairly by a staff person or another resident, concerns about food, how their room is being cleaned, etc., but wish to remain anonymous, we can ask other residents if they have had similar issues. And if we find there are others expressing the same concern, we then can communicate these concerns to the facility administrator without specifically naming those residents. Whether the resident is there for a short time or will live out their life in the facility, this is their home, and they need to know what their rights are and to know these rights will be protected. Establishing a relationship with the residents and sometimes family members and getting them to trust us so we can help and assist them is critical. When complaints and concerns do arise, we attempt to work as a team to find a resolution that will work for all involved. We also attend care plan meetings, which are also called care conferences, and work well with the residents and staff. Keeping the lines of communication open is critical. Again, only with the residents' consent. Additionally, we work with local law enforcement and adult protective services when necessary. When COVID first began, our ability to visit the facilities was not possible, but we called the facility management every other week or more often to check on how things are going, to inquire about staffing, checking on the current census, to see if they need anything, letting them basically know that we're here, checking in. We were also available by video, FaceTime, Zoom meetings with residents if they request. However, most residents don't know how to use a smartphone. So most times we're depending on the staff to report to us honestly about how the residents are doing. We are now able to go back into the facilities, yay, since we are classified as essential workers and now can attend meetings and resume our visits with the residents again. As always, we are following the proper infection control guidelines and we get tested on a weekly basis. We also receive much needed PPE, personal protection equipment from the state, community care licensing, and the Office of Emergency Services, and have been able to provide the facilities with much needed supplies such as masks, sanitizers, and other protective gear. Shortly after COVID hit, we did several projects so the residents would not feel so alone and isolated. We got our local community involved with sending cards to the residents, as well as helping us purchase Christmas gifts this past year. And every nursing home resident here in Humboldt County received a Christmas gift this year. I last month went to the local grammar schools and got the kids to make Valentines. And the facilities were just overwhelmed with these beautiful cards that were made by the local kids. We still encourage the community to send cards as a way to keep the residents connected. We are recruiting for volunteers because our job is essential. I'm sorry, that's my cuckoo clock. But because our job is essential, it's important to get into the facilities and interact with the residents. So being able to have more volunteers is critical. If anyone is interested or knows someone who might be interested in a volunteer opportunity, I can provide more information. The certification training requirement is 36 plus hours of manual training, which can be done at home or on the computer and with follow-up phone and Zoom meetings. Following training and certification, a new volunteer will shadow a senior advocate or one of our staff. We ask that volunteers are able to commit to 12 hours a month, and we can easily work around anyone's schedule. We work with new volunteers till they feel confident enough to visit independently, and we are always here for support throughout our advocacy activities. So again, thank you for your time. That pretty much ends my presentation. Did anyone have any questions for me?
No, Leanne and I haven't had DOP, I think because COVID was a big part of it. I know I worked with Susie in the past on a few things, and it was, yeah, you guys, because we have elders that I get complaints every once in a while, not as much lately, but elder abuse by a neighbor taking advantage of an elder, and then the other neighbor gets involved. And I know you guys become a go-between, and I know there's a lot of that. And then with the care homes and agencies and everything else. So I think you said it all when you first started. You're the volunteer coordinator. So I want to double your pay now because I mean you're not getting anything now. So you get twice. I'll just thank you twice as much. But I really appreciate you.
Well, be sure to
because. Go ahead.
I was going to say, be sure and tell Susie that.
But I'm
a
just
lot
saying,
of it is so rewarding.
And I know you have costs. I know you have costs involved. And I know in the past, we've gone out and got you small parcels of money just to cover expenses and travel and stuff like that. And I haven't thought about it lately, but I get quite a few calls from people saying they'd like to donate some. And this is a great program because if there's any luck involved in this world, we're all going to be old and probably need somebody looking out for us. So I appreciate you for taking that role on.
Yeah, and
Rex, thank you so much.
Yeah, I appreciate Supervisor Bohn bringing this today. You know, I remember when I've had relatives in care homes, and I've had, you know, constituents in care homes, and all I can say is, you know, the program is wonderful. Susie's a rock star. Susie is on this call, I believe. I see her name.
Yes, she is.
I'd like to give her an opportunity because from her I've learned so much more. I had no idea what the program was or how they could help, and Susie is so reachable and helpful. So Susie, sorry to put you on the spot.
And
would you
forceful.
like to say anything? Oh yeah. You want to say anything, Susie? You don't have to, but wait, where'd she go? All right, is she still on, Ryan, or did she drop off?
She's there.
Okay, Susie, is that, are you saying you don't want to say anything?
Hold on. I didn't realize Susie was a part of the meeting.
Okay. Well, and she probably didn't realize she was part of it, but I think she's the one that many of us deal with, and I saw her name, so she is now, I'm
correct.
taking her into it.
My apologies. I wasn't aware.
That's all right. I didn't know she was going to be on. Oh, what a cute dog.
Yeah. Yeah, she's my backup, and it's
Hi, guys.
Is she there? I'll shut up.
Yeah.
I just wanted to say hi and great job, Leanne. You did amazing. And as far as donations, we always accept donations, Rex, because these folks really, really need us, and the more we can support them by doing activities like such as Leanne's doing, is just it benefits it all. Because one thing that people seem to forget is, because somebody goes in a nursing home doesn't mean that they're getting the love and attention that a family or a friend can give them. They may be getting care from a provider, but they still need that love and attention of family members. And I tell people, you know, these are our school teachers, our Sunday school teachers, our Boy Scout, Girl Scout leaders, of, you know, the mom that was home baking cookies because your mom worked outside the home. So I just encourage all of you to remember that we're here for your constituents. Is that the right word, guys? When they go into a facility, and we do go in on a weekly basis, which is amazing for this program up here. Leanne and I have spent many, many hours going in because advocates could not due to multiple reasons. So you know your family and friends are being well cared for, and I'm going to sign off right now because I hadn't planned to make a presentation, and I love to talk. Right, Rex? And Virginia, thank you.
Susie.
Yeah.
I've not had the opportunity to meet the other supervisors, but I certainly enjoy working with all of you. If you have questions, give us a holler.
All right. Thank you, Susie. Sorry to drag you in. So Leanne, I guess I'd ask if someone does want to reach out to the group, or to your organization, what is the best way? You know, is there a number that is considered, you know, that how do people get in touch with you if they don't know Susie's number?
Thank you, Virginia. Even though we're currently still not working out of the office, people can still call in to our line, which I want to emphasize is a confidential line, and it is 707-269-1330. And we check voicemail every day. So if somebody leaves us a message, we will call them back. But we do want everybody to know that that is a confidential line.
All right, thank you. Supervisor Madrone?
Thank you, Madam Chair. Thank you, Leanne, for being here today and presenting to us, and Susie and everybody at Area 1 Agency on Aging. You know, the work you do is just so amazing. As the new representative for the County Board of Supes, I look forward to future board meetings and working with you all. And again, thank you so much for everything you do.
Well, thank you. You're very welcome. I enjoy it.
All right, any other questions at the moment? Supervisor Bushnell?
Morning, Leanne. I haven't had the pleasure of meeting you yet, but I wanted to say hi, and to Susie, who I also haven't met, and to say that the work you guys do is amazing. The elder community, as Supervisor Bohn said, we're all getting there. But, you know, my grandparents were special people to me, as most are. And so I really appreciate everything you guys do.
May I quickly invite any of you supervisors who would be interested in touring a facility in your community, give us a holler, because I would just be happy to take you through any one of the nursing homes or the assisted living facilities if you're interested in visiting them. So just give us a call.
They'll take you up at election time.
All right. Supervisor Wilson?
Yeah, as someone who's had several relatives go through these facilities or have been, you know, part of this system, and I really do appreciate this work that's being done, because not everybody in those spaces, you're correct, has family that's visiting every day or has the capacity to do that, quite frankly. And that's actually part of the reason why some of these places exist, is just, you know, we just don't have some of those structures that we once had. And I appreciate this informational for us and kind of for us a lot of reminder how important these services are. And also, you know, the audience for this is this meeting and this presentation is, well, there's us, and then there's a few people watching, and then there's the public access television that airs this once. But I would say that, you know, there is space on that public access. I do follow your Facebook page, and there's good information on there. But I'd say that, that I think public access would probably be a good spot to for more and additional information, and quite frankly, even volunteer recruitment through that media outlet. So thanks a lot for all this, and hope we'll see more of you in the future.
Thank you. And another option, I think every once in a while, we all speak at KINS, we do the talk shop. And sometimes, I've shown up with people in the community who do different things, and it's another opportunity perhaps to share some of what you do. So one of us may be able to give you a call and ask you to join us.
I would love that. Thank you so much. Any help in getting the word out is greatly appreciated. Thank you so much.
Well, that's good. We're going to head out and see if we've got any public comment. This is an incredibly quiet public comment group so far. We have no hands up. So we'll go back to the board. Ryan, do you want us to take a motion to receive and file, or do you need anything at all from us that's official?
That would be very helpful. Receive and file.
Okay.
I'll make the motion to receive and file.
Second.
Right. Okay. And just to tell you guys, if we don't vote against it, it doesn't mean anything. You obviously, we received and we filed, but we still have to vote on it. Go figure. Ryan?
Thank you, Chair. Supervisor Bushnell?
Yes.
Supervisor Madrone?
Yes.
Supervisor Bohn?
Yeah.
Supervisor Wilson?
Yes.
And Supervisor Bass?
Yes.
Thank you. Passes 5-0.
Thank you for being here, and I think we got you out in plenty of time for your next meeting, Leanne. So glad that worked.
Thank you again, and it was so nice getting an opportunity to see all of you. Look forward to seeing you again in the future. Thank you again.
You bet. Thanks, man.
Thank you. All right, so and we're hitting on to department reports, and the first two come to us from the clerk of the board. And the first is regarding potential amendments to the protocol for Board of Supervisors appointments. And we do have our deputy clerk of the board, Tracy D'Amico, with us. So Tracy, I'll turn this over to you.
Thank you. Good morning, Chair Bass and board. This morning before you is to consider the amendments to the protocol for your appointments to various boards, commissions, and committees. So the original protocol was developed in April 1st, 2014, and the last time it was updated was in 2018. So the first attachment would be the 2021 list of board appointed committees, commissions, and boards. As you know, this list changes quite consistently. Already we'll add the audit committee to this list at additional to this list. The biggest change would be the protocol to appointing at-large positions on various boards and commissions. In the past, we have provided an agenda item to note the vacancy, and then we would follow up with either a board recommendation to an appointment or a set a date recommendation agenda item, and this sometimes became confusing. So staff and I reviewed this process, and we would like to change that protocol. So when an at-large vacancy is posted, there will automatically be a time set 4 weeks later, or the next available meeting after that 4 weeks, to consider that at-large appointment. This would just help in the transparency aspect and in the recruitment aspect and getting those applications and having a larger pool to draw from. The other thing that has changed since 2018 is our agenda management system. So we have updated the amendments, the appendix 1, 2, and 3 on this protocol, showing what those 3 agenda items would typically look like on boards and appointments to these commissions. The board-specific appointment agenda item will not change. Any supervisor can bring that. It'll be on consent. The notice of vacancy for at-large appointments will also be a consent item. And then the consider appointments for at-large vacancies will be a department item, as you've seen we've done and as we're going to do soon in the next item. So with that, if there's any questions, I'd be willing to answer those now.
Thank you, Tracy. Any questions? I'm not. Oh, Supervisor Bohn and then Wilson.
Well, since we do this every 4 years and update it, and I really appreciate anything, I just make a motion, we accept staff's recommendation. They're the ones that have to work with it.
Second.
All right, we have a motion that's been seconded. Supervisor Wilson, did you want to say something?
Nope, that's, I echo that sentiment.
Okay. I just saw your screen lit up, so I'd ask. All right, well, let's go to the to the public. And there are no hands raised for public comment. Yeah, so, yes, Supervisor Madrone.
Yeah, I too want to thank staff for their work. You know, that's constant, having to update all these procedures and processes. And in this case, this is a fantastic update, clarifies, simplifies, and really makes sure that we have that public involvement. So thank you, Tracy and all the staff for your efforts on this.
All right, well, with that, we'll go to a roll call vote. Ryan?
Thank you, Chair. Supervisor Wilson?
Yes.
Supervisor Bushnell?
Yes.
Supervisor Bohn?
Yep.
Supervisor Madrone?
Yes.
And Supervisor Bass?
All right, thank you. Passed
Thank you.
unanimously.
Passes 5-0.
Okay, so we'll continue on with the clerk of the board for the next item, which is to consider making an at-large appointment to the alternate position on the Measure Z Advisory Committee. And Tracy, there's 2 alternate positions, correct? Okay.
So there are two alternate positions, and currently Eddie Morgan is an alternate. So on the Measure Z, the alternates are non-voting members. And so Justin Robin was moved up into the at-large member that votes. And so we did have this vacancy, and we posted the notice on a previous agenda item. So today before you, you can consider making an appointment to that alternate position. And there are 4 applications listed. I did reach out to everyone that had applied previously, and these are the 4 that have turned in an application. They've been notified about this opportunity today. So you have those 4 applications in the list in front of you to review.
All righty. Any questions or comments from the board at the moment? Do we have any of the applicants on the line that we know of? Ryan?
Chair, not that I'm aware of. I don't see any of the names. And then I would ask if there is and they're called in, just to push *9 on your phone, and that will raise your hand.
Okay, we'll give that a moment or 2.
I did notify them that they would be able to have 3 minutes. I wasn't sure about the time, so they may not have had an opportunity to call in. But they did all email me that they were still interested in being considered.
Okay. Well, then in that case, I don't see any of them raising their hand to say anything to us at the moment. Supervisor Wilson?
Thank you, Supervisor Bass. I just wanted to, again, make a pitch for Catherine Muncie as an alternate. My position is based on the very robust experience in the field of health and mental health associated with her application. I think there is a need for that viewpoint on Measure Z, really quite specifically. We're hearing that being brought up in terms of our public safety and the need for that nexus. And so that's what I am asking the board to consider.
All right, thank you. Any other thoughts from board members? Supervisor Bohn?
Well, I don't know Eric Rublikova at all. I know he's on the Lolita Fire Department, and they, but again, I will say I would like to see the Latino community represented. I know we've talked about that before. He comes with a wide variety of both rural and suburban firefighting, public safety, ambulance, and along those lines. And then my second choice would be Tammy Trent, who has, I think, attended every Measure Z meeting there's ever been. She did call and say that she was working today and wouldn't be able to call in at, I told her between 10 and 10:30, so I was pretty close, but she wouldn't be able to call in. But those would be my two choices, because we talk about diversity. We should follow up and actually do diversity. So.
Supervisor Bushnell?
Thank you. And I wanted to say also that Tammy Trent called me yesterday and isn't able to get on today because she's working. I had a long discussion with her, and I like what she had to say. I also like that she has attended every Measure Z meeting since the Measure Z was formed. And so my first choice would be Tammy Trent.
All right. Any other comments? You know, I would just say it's good that you have multiple people who are interested. You know, I thought Catherine Muncie made sense from the standpoint of the mental health perspective, also just because I know there's an awful lot of and upcoming issues, I think, with areas of mental health that people would like to have represented. But I also don't think it's been forgotten. I know that through, you know, the MIST and working with EPD and stuff, I mean, I think, and so I think there is at least some focus on it at times, but I think it would have been a good voice to have. And if she doesn't get it, I recommend that she come and speak, you know, and be there as a member of the public to kind of provide some info, which is perfectly good. Tammy Trent, I think, you know, she's been at every meeting. We know she's really interested in it. She would be my second, you know, and I'm sure Ruben is nice, and I understand the diversity. My concern is, and well, maybe not concerned, but we do have fire, that piece of it is somewhat present already, but you know, I'll be basically fine with whoever we decide to move forward. Supervisor Madrone?
Yeah, my first choice would be Catherine Muncie for all the things that have already been stated, but I also would be fine with whatever the board's decision would be here. You know, diversity comes in lots of colors and shapes and sizes, and there aren't that many women on the board, and I think it'd be nice to have a little more balance there. So diversity comes in lots of ways.
On that note, you know, and like I said, I like the mental health aspect. Tammy has been there and kind of, you know, not paid her dues, but obviously already is up to speed on a lot of the issues. So if I had to choose between the two, it'd probably be Tammy. Supervisor Madrone, Bohn, just wait just a second. But all right, go ahead, Supervisor Bohn.
I'm just, and Lolita has their own taxing agency, so we gave them some, but they don't come to us for money. So I was just saying, and if you look at his background, the other thing is how many Humboldt County employees are we going to put on this? I mean, we just put Bronco on there. Now we're putting another Humboldt County employee. We have the sheriff on there. I mean, I can go. I mean,
but Miss Trent is not she doesn't.
Miss Muncie is. Miss Muncie is. She used to be planning the building. Yeah. Okay. I understand.
Okay. No, I think what I'm hearing is people would be happy with anyone basically, and I agreed that you know, I think Captain Muncie, you know, would be fine as a member to come in. I mean, someone of the public. That's all I'm saying. Anyway, I think Supervisor Bohn was basically making it clear that he believes that Ruben probably has more of the experience that he's looking for.
No, I just don't want a whole bunch of Humboldt County employees on the Measure Z, because it's all encompassing of incorporated cities also. So
you'd be supportive of Miss Trent?
I said that. I said I would, Ruben was first, because I would like to see somebody that could, you know, talk to the Latino community to get that involved, because we talk about that a lot. And it's been brought up by other board members that we need to show diversity, and this is the time we do it on commissions, if it fits their narrative. And then, and again, Catherine Muncie would be taking the place of a woman that sat down. So you're exactly right, that stepped down. So I'm fine with that. Like I said from the get-go, Ruben or Trey, I just don't know how many Humboldt County employees we want to get on. It is our tax, but we're trying to include it's public safety for the county. So
Okay.
I gave my two at the beginning.
Well, I just wanted to make sure that you were still okay with that.
You never have to worry about me.
Would anyone like to make a motion on this? See where it goes? Or not?
Well, I'd make a motion that we pick Eric Ruben as the alternate on the Measure Z. It won't get a second, and then we'll go from there.
All right. If it's not getting a second, is there someone who'd like to make an alternative motion?
Well, I'll make a motion to appoint Miss Muncie.
Okay.
I mean, if that's what we're going to do this.
Second.
Yeah. Okay. Got a motion in a second. Let's see if there's anyone in public comment. I do not see any hands up, so we'll come back to the board. You know, I've got to say, I really like the idea of Catherine being on there. I hear Supervisor Bohn's concerned. I do know Tammy Trent has been very involved, so I don't want to vote against Catherine, but I think I need to support Tammy first just because she's been there through so many meetings. But I would really like to encourage Catherine to be there to present her perspective and, you know, and then go for it again. It's tough.
So as the motion maker, I just, you know, I will withdraw the motion, seeing that there are probably not going to be 3 votes for that, which is fine. I want to say that, you know, one of the reasons Bob Bronkel wasn't on my list at the last time we did this was because my choice for county employee was really, you know, if I had to choose between the two, was Ms. Muncie in relationship to her experience in what's needed in this space. I have worked with Tammy on other boards. I do appreciate her work in terms of everything she's done, both with City of Fortuna and all the other boards and commissions that she's been on, and appreciate that. But if I, you know, but it's not my first choice. But you know, seeing where this is going, I don't want to prolong this any longer. So I'll let someone else make the motion so we can move it along.
I'll make a motion.
Supervisor Bushnell has her hand up. Perhaps she is, sorry.
She can make the motion.
I'll make a motion to appoint Tammy Trent as an alternate for Measure Z committee.
I'll second that.
Okay. So we will go back to the vote then, I guess. I think we're ready, Ryan. Excuse me.
Thank you, Chair. Supervisor Bohn,
Yes.
Supervisor Bushnell,
Yes.
Supervisor Wilson,
Yes.
Supervisor Madrone,
Yes.
and Supervisor Bass.
Yes.
Thank you. It passes 5-0.
Okay. And thank you, Tracy, for being with us this morning.
Thank you, board.
And so we'll move on to our third departmental item, which comes to us from Public Works, and it's regarding potential use of the courthouse wall on I Street for a mural as part of the 2021 Eureka Street Art Festival. And I see Director Madsen is here after all. Well, turn this over to you.
Morning, Chair Bass, members of the board. Tom Madsen, Director of Public Works. The department has received a request to use the I Street side of the courthouse. It's basically a canvas for a mural to be done this upcoming Eureka Street Arts Festival this summer. We have Jenna Katzos with us this morning to make a presentation on behalf of Eureka Street Arts Festival, and we can follow up with questions after that. Thank you.
Hi, everyone. Nice to see you all this morning. Thanks for making time for us. I am going to go ahead and share my screen so that you can see our presentation. All right. So my name is Jenna Katzos, and I am one of the organizers of the Eureka Street Art Festival. We're really happy to be presenting to you today. We've had our eyes on this wall for a while. It's a big blank wall, and so we're excited about the potential to perhaps do something with that. So our ask today is to have you authorize the use of the Humboldt County Courthouse on I Street for a mural in this summer's festival. We are also asking that for the process of figuring this out, that we could work with the Public Works Department to coordinate and implement the mural. And then we would come back to you, actually before we implement it, with a rendering so you could see what it is. We don't have a piece of artwork to show you today. We're just the first step asking if you'd be open to it. So a little bit about the Street Art Festival in case you are not familiar. It is a week-long citywide event that takes place each summer. And the core mission of the festival is to create intentional, accessible art that enlivens public spaces, stimulates community revitalization, and attracts visitors to Eureka. The festival is sponsored by the Humboldt Cider Company, Pen and Pine, and the City of Eureka. And those three entities also line up with the three organizers, myself, Michelle Cartledge, who owns Humboldt Cider Company, and Swan Asbury, who is a planner with the City of Eureka. And we put it on together with a bunch of volunteers, and we ourselves are also volunteers. And just want to mention that we are a Dreammaker project of the Ink People Center for the Arts. So we have their support as well throughout this project. A little bit of history, the festival started in 2018. That year we focused on Opera Alley. We had 24 artists and they created 22 pieces of public art. 2019, we moved to downtown Eureka. We had 20 artists. They created 20 murals and 6 tiny sculptures. Last year, we were focused on Henderson Center, and we created 12 murals and 8 sidewalk poetry installations. Something really wonderful about last year is that we were able to make it happen even though we were dealing with the COVID pandemic and figuring out how to still bring this to the community in a safe manner. Some notable moments from the last few years. We've had thousands of people attend the block parties, which has been a really wonderful thing. Each year, except for last year, we have a large block party to culminate the festival, to celebrate it, to have people out to see the artwork and appreciate it in a new way. We also focus every year on maintaining existing pieces of artwork. One of the things that really drove the creation of this festival is the fact that Eureka was already doing public art really well. We had a huge number of murals, and it was something that we realized that we could capitalize and just kick up a notch. And so every year we try to revisit an existing mural in the city and repaint it, revitalize it in some way so that we're also maintaining our current artwork while adding new. It doesn't want to show you the next slide. Give me 1 second. Oh, now it wants to show you this one. All right, let's see. Okay. So last year, we were also able to implement a new project, and that was the Native Mural Project. This has been another really big celebration of the festival. We were able to invite 4 artists that represented local tribes, and they painted one wall with 4 individual pieces, so it created one impactful piece. And I really think this helps illustrate the way that the community comes together for this festival and the way that we're able to represent things that the community want to see and able just to represent our community through the art that we have in the city. Some community benefits of public art. I love talking about this. I think initially some people are like, yeah, it's pretty, but so what? Public art can be a really incredible tool for cities and counties. It generates community pride. It makes areas more welcoming and walkable. That was one of our focuses, especially in the first year with focusing on Opera Alley. Murals generally get people to stop and to get out of their cars and to explore. While they're out of those cars, they are more likely to stop at a restaurant, a coffee shop, go into the shops, which helps benefit our community through economic development. We also wanted to mention that we've worked with government agencies before. We understand that you have your own set of processes that we'll have to abide by. This was 2019. We painted this mural on the wall of the fire department, and they were an incredible partner. They came to us with kind of a general idea. They worked with the artist. They even took him up on their, I don't even know what it's called, the engine that lifts people high. And it was a really wonderful collaboration. So a little bit more information. Cost, so it's a massive wall. It could be up to $36,000 if we paint the whole thing. Most likely we will paint around $20,000 worth, and we pay our artists $10 a square foot to ensure that we are paying them a living wage. But the great point is that we're not asking you to pay for this. We will raise the funds, and I want to point out that none of those funds will be coming from the city of Eureka either. We raise a lot of funds through community fundraising, business sponsors, and grants. And so that's how we will get the money to pay for this mural. Maintenance, we ask that you commit to leaving the mural up for 5 years at least. After 5 years, if you're sick of it, perhaps you'd like to paint another mural. But during those 5 years, we will maintain it. And what that means is any graffiti, anything like that that needs to be touched up, we will do that. Luckily, this wall is really high off the ground and not very accessible. So hopefully it'll be less on that regard. And we've also found that walls that tend to get tagged and get a lot of graffiti on them, once they get a mural on them, that is generally really reduced, which is a great benefit. And then selecting an artist. So we will work with you to try to bring an artist in that you're excited about. We are hoping to use a Humboldt County artist for this wall for a lot of reasons. And one of the other things that we will really consider is the fact that this is a massive wall. And so we will only consider artists who've worked on this scale before, because it's a large undertaking. All right, it wants us to pause for a moment. There we go. All right, so the process. What we generally do with other property owners is a little bit different than how this will work with the county, of course. But we will enter into some sort of a contract with the county, and we'll work with folks on staff to ensure that this is something that works for you. And the contract basically says that we're going to paint a mural. And then we will work on artist selection. And in a moment, I'll ask if you have thoughts about this, if you are open to the idea of having a mural, if there are people maybe that are coming to mind already. And then we are hoping that we could work with the CAO office to choose an artist and then come back to you with a rendering. And then the mural would be painted during the festival, which is August 7th to 14th. And we have already talked, though, depending on the artist and how they're feeling about the size of the wall, this potentially would be a slightly longer term. Generally, the murals in the festival are painted in 1 week, which is really quick. And a lot of it, it's international artists who can bang these things out. That's what they do every week of their lives. But we realize that this is a really large wall and we want to make sure that the quality is there. So we would potentially increase that timeline to help them wrap it up. In a moment, it'll advance. Everything's a little slower today, huh? There we go. All right, so I would love to hear your thoughts. Does this sound like something you would be open to? If so, is there specific content that you'd be interested in seeing in this mural, and any suggestions you have of an artist that you would like to see?
All right. Well, thank you for the presentation. If you want to stop sharing your screen, then we can see what questions or thoughts we have. And any supervisors have a thought at this moment? Supervisor Wilson?
Yeah, I'm highly encouraging of this effort. I don't really have a particular artist or theme that I think, quite frankly, I've had no input on the artists or themes in terms of like what's been happening in Eureka so far, and it's been great. Some things I like more than others, but that's art, right? That's how it rolls, and I'm happy about that. So whatever I can do to be supportive, I think this is great. I'm happy to lend my support. Thanks.
Okay, I don't see hands up at the moment. I'm supportive as well. I mean, as long as the courthouse has always been one of the strangest structures, and how it's been painted in the past has been a conversation throughout the community. And so I think having something to brighten it up would be wonderful. I don't know of any local artists as well. So I would hope that, you're able to bring a few really solid candidates forward, because it is a very big wall. But I'm looking forward to this happening. Supervisor Bohn?
Yeah, I think even though I loved it, I don't think we want cats eating sushi. But but what I'm saying is, I think we need to be middle of the road. I mean, I see forest, I see streams, I see some of the, something kind of in the middle of the road, just deflecting. And I'm always wondering why the city isn't doing. I know you've got a big billboard on the side of your building. I'm wondering why you've never done your own building, because that's a big site too. So I was going to suggest that, because you have a billboard there now. So I'm in favor of that too. But I think we have two pieces of art at the entrance to both of our that were actually done when the courthouse was done in the 50s. And I don't think anybody was done by the architect's wife, I believe, the tile. And I mean, I would actually wouldn't mind seeing, except it's a logging scene, so that would probably be out of the question. But I think something reflecting our natural beauty. I would please ask that we have a pretty good input, and I think we could run this through Public Works. I don't think our CAO's office needs to be in the art business, but I would also like to make sure that our bank next door is included, because they have to look at it every day. So I think we have to be somewhat cognizant of our neighbors, and they're probably the main one that has to look at it every day with their customers. So I think something along those lines, I'd like to see them included. But I'm in favor of it, as long as it's middle of the road, and I'm sure if it's going on our courthouse, it's going to be dialed down to the nuts. But I just think trees, ocean, and fish are what made I'd like to see something historical, what made this community. I like the one down there by the Alp scenes, and I mean, just nature scenes. I mean, I hopefully we're not going to say anything political. So I'm in favor of it. I just go right away. And if somebody wants to tag it, they get up that high, more power to them.
I actually like the cats eating sushi, but I'm weird. Supervisor Bushnell? And then Madrone?
Thank you. I would just, I also think that whatever we choose should be very neutral in content. The courthouse is a public building that, people see as for different reasons, and I just really would like to encourage something very neutral in statement. I also think that Public Works is more the place this should be. I don't know how or Director Matson feels about that, but I don't really think it needs to go through the CAO's office. But I don't know, maybe the CAO's office has a different opinion. So I just am really encouraging very neutral in content.
All right, Supervisor Madrone?
Yeah, thanks, Madam Chair. I'm supportive of this project. I think it's fantastic. I applaud all of you for your efforts over the last number of years. in beautifying downtown Eureka, as well as Henderson Center. All of them are just magnificent, and I love the variety. I was thinking that, one way to handle it, I mean, on one level, we want to stay neutral and avoid controversy, but on the other hand, it's okay to talk about who we are. For instance, there's a beautiful book called Two Peoples, One Place that does an incredible job of trying to speak to our Native American heritage and culture here, but also to our logging and ranching culture and history and fishing, and I think that we can actually do a really good thing in regards to all of those things. And so I'll just say that the Two Peoples, One Place is something that really has done a fantastic job of trying to talk about the fact that we do have that mixture here in Humboldt, and it's something to really celebrate. So, but again, whatever you guys come up with, I'm sure it's going to be fantastic. Very supportive.
I have a question for, because I've heard a couple things say, people say they think this would be best going through Public Works, and while I think Public Works certainly has a component, I'm not sure if Tom has so much time on his hands. Well, actually, everyone's very busy, but I'm not sure if he wants to be the one choosing the art. Since it mentions CAO's office, I'm just curious if our CAO would like to comment. I mean, what their thoughts are on this, because you are listed as well.
Chair Bass, I'm happy to help in any way, shape, or form that your board wants me to help.
Okay.
And also from Public Works, we are very, very strongly supportive of moving this forward. We do not want to be the ones picking the art. Frankly, my favorite artist is Botticelli, who is not without a little bit of controversy. So I would prefer, as they have recommended it, be a public process that comes back to the board rather than having Public Works pick the art.
Thank you, Tom. I appreciate that. That's kind of what I was, why I wanted to ask you. Anyone else on the board have a question or thought at the moment before we go to public comment? Supervisor Wilson?
Yeah, just to comment. So often we talk about public art as reflecting our past, and sometimes I'd really like to offer that maybe public art can reflect our future as well. And so it's just one of those things that there's so much variant in what that means, and so I'm still very open to subject matter format. I mean, in general, I do like public art that tends to be a bit more positive, or at least project positivity into the landscape rather than something that can be kind of darker, which sometimes that we need those things too. I mean, we need those reminders of our society. Nonetheless, let's do this. Let's move it forward.
Okay, thank you, Supervisor Wilson. Well, it's a really big wall. Perhaps we'll have the past, present, future.
We could probably paint every person in the county.
What, Supervisor Bohn?
We could probably paint a picture of every person in the county and just cover all our bases. But I don't think I said what I want to do is what I would like to see, something that represents Humboldt County, not necessarily past, maybe something in the future. Maybe we could put windmills out there. I don't know. And then we cover dark and future. But I'd like to make a motion, then go to public comment.
Well,
or you want public comment now? Is there a big line?
No, but if you'd like actually go to the process and make the motion so we can get a second, then we'll move from there.
I'd like to make a motion that we work with the arts, and actually staff's recommendation is Public Works, but I would like to take staff's recommendation, but I would like a committee of 3, someone from Public Works, not necessarily, but somebody from Public Works, somebody from the CAO's office, and Supervisor Bass, since it's in her district, to review and decide what would work best for the big blank space on the side of I Street.
Is there a second?
Second.
Thank you, Supervisor Wilson. Supervisor Bushnell?
So would it come back to the board for review, or would that be the committee that decides the artwork?
It says it comes back.
I would think it's supposed to, it would, well, we can add that as an understanding that it would come back to the full board. Is that correct?
You know something, I'm fine with you three deciding. You heard us all here talk, and we can all bring it back and decide that we want this, this, and this, but it's there for 5 years. I'm willing to do it, and if it's really bad, we can blame you. I mean, I don't think it has to come back. It's a painting on, I mean, if you go down there and look at the side of the Arkley building, you take a look, I mean, you can't think, I mean, Dwayne started this revolution and has done a really good job, and he's been really great about using diversity, the youth, and getting everybody involved. And I'm not saying Dwayne's the only one, but I mean, he's the one that actually can work on that size of a structure and makes it looks really good and can fit the essence, and he pretty much understands the whole. But I'm just saying, I'm willing to let the CAO's office, Supervisor Bass, and Public Works make the decision. I don't think it has to come back up.
So
When I drive by if I don't like it.
So that's great, Supervisor Bohn, but Director Mattson said he doesn't want to make the decision for artwork.
I agree with that. I said someone from Public Works, not necessarily Mr. Mattson. It could be Bronco. It could be it could be somebody from facilities, which Tom, oversees, but we have somebody that actually manages facilities. I'm just trying to get 3 people.
Well, can I clarify whether Director Mattson was speaking for his department or for himself?
I was speaking for myself, frankly. I would put my deputy director of that facility, Sean Meehan, in this position. He is an architect. He does have an artistic background, and he is very, very supportive. But again, I would recommend, even if you have a review committee, that we come back and, we're all more than willing to come back and make a final presentation and say, this is what we're planning, so everybody knows.
Okay, Supervisor Bohn?
Just so you know, this is the end of March, and they want to do this in August, and we're not known for working at blistering speed. So I'm just saying, and then we take time off during the summer and people are missing. So I'm just trying to circumvent just getting it done. I mean, we can bring it back, but I worry about when everybody can actually do that, because it takes us a couple of years to change anything almost.
Can you clarify the motion again, please?
Staff's recommendation that we hear the report, authorize the use of the Humboldt County wall on I Street, authorize Public Works to work with Eureka Streets Art Festival, and have a committee of 3, Supervisor Bass, it's in her district, someone from the CAO's office who has agreed to work with it, and somebody from Public Works so they can talk about what paints are being used, what's going to be used to seal it so it doesn't peel. So we have 3 experts on board, and then they can decide. And I think they've heard our whole guys that we want the future, we want the past, we want, we've all thrown something in there. I would just like to see something Humboldt. So they've got that, and they come up, they get it painted, and we go out the end of August and have we're all excited.
Thank you.
And I thank you for clarifying. I'm hearing Director Mattson say, however, that he believes it should come back for review. So Director Mattson, I guess I would ask you, Supervisor Bohn is concerned about the time frame. Or you or the team?
I'm just saying that we're more than willing to come back if that's what you would like to see. If you just want us to go for it, we're more than willing to go for it.
I got full faith in our staff.
All right, County Council Billingsley.
Chair Bass, I just wanted to say, depending on the nature of this contract, it may need to come back to your board anyway to approve the contract. I don't know if there's going to be money associated, if it's going to be a purchasing agent contract, or if it's something your board should approve.
Okay, so maybe we shouldn't necessarily get ourselves involved in the process of what's going to happen right now.
Well,
and Supervisor Bohn?
Jefferson, I fully agree that there's going to be a contract. You guys get to look at it again. They've done this on other buildings, public buildings, and everything else. So it's going to be a cut of the mill, $2 million, the same thing that they have. We can do that. What I am saying is, I don't think we need to critique what they choose. I think we should let the artist, because the artist is going to have to spend a lot of time preparing and then figuring how he's going to do this, because obviously we have 35,000 square feet. So, we have a pretty good sized wall. So the contract will come back. and that is that the contract isn't what they're going to pay, it's how they're going to do it, and to protect our liability, our 5 years, we can cover it up 5 years. It's the same contract they've probably done with everybody. What I'm saying is we don't need to critique the artwork, and in all honesty, we're gonna put the contract on consent and say, okay. So I understand that part will come back. I just don't think we need to see the artwork. The ugly contract part you will have to deal with.
I've got okay, so your motion is not to necessarily come back. However, someone could decide to put it on, and which will probably be me, just to have a report on it. So there you go. We can do both. So Supervisor Bohn is not wanted to come back for approval by the full board.
If it can come back, I'm just saying our wheels turn very slow.
Okay, I'm trying to give staff like some direction, and if you don't think it needs to come back, then that's what I.
We're going to start it in 4 months.
Well, and if it doesn't come back, we have your promise to not complain about what it ends up being.
I don't care.
Okay. All right, so
it's pretty ugly now.
I'm going to go to public comment right now because Supervisor Bohn is making this a little more confusing than it needs to be. So, is there anyone in the public who wants to comment on this today? And there's, what a surprise, nobody. And I do see we have Christine and Swan on here if they had anything they wanted to add to this. And yeah, on the presentation, Swan just waved.
I just wanted to add that this year's theme is going to be a welcoming and wayfinding theme. So we're focusing this year on the 101 corridor. And we're just doing a handful of murals this year instead of doing, 20. So I just wanted to share that with the board, and that's it.
All right, thank you, Swan.
So it's going to be a mural of a traffic jam? Anyway, that's all right.
Oh, and Christine staying quiet, so. All right. So we are back to the board. Yeah, so there's a motion on the floor. And Ryan, can you tell us what you believe the motion to be so that we are all on the same page?
So my understanding is that we're approving staff recommendations and we are appointing a review committee of 3 members comprised of a representative from Public Works, a representative from the CAO's office, and Supervisor Bass to review and decide on the mural.
Okay. And the seconder is fine with that?
Yes, I'm fine. And I want to just say that I concur with Supervisor Bohn in terms of the freedom of the artwork. And so, but if you feel more comfortable bringing a presentation back to the board, I'm okay with that too. It doesn't matter to me.
Yeah. And that's something I think we can just decide a little further down the road. So with that, Ryan, would you do a roll call vote, please?
Yes, Chair, thank you. Supervisor Madrone?
Yes.
Supervisor Bushnell?
Yes.
Supervisor Bass?
Yes.
Supervisor Wilson?
Yes.
And Supervisor Bohn?
Please.
Thank you. Passes 5-0.
All right, thank you. And thank you all for being here. And we'll look forward to moving forward. So before our next item, I've had a couple requests for a break. So I think we'll break for 15 minutes, then come back to the public hearing. So we'll be back at 11:15. From our break. So we do have a public hearing today, and so this is where we're going to go. And it comes to us from our planning and building director and is an appeal of the Planning Commission denial of an after-the-fact coastal development permit. Prior to handing it over to Director Ford, I just want to set out how I think this is going to go or proceed, and so people know. First, of course, we'll have the staff report, and then the appellant we'll have the opportunity to present, it'll go to the public comment for whatever public comment. When it comes back to the board and we start our deliberation, I am going to give the appellant the opportunity after we come back from public comment to clarify anything he thinks we should know and to add any other information at that time that he thinks is important for us to have. And then when we do get to the discussion with the board, board members can call on the appellant to, if we have questions, but anyway, so I think that's kind of how I plan this to go, and so we'll see what actually happens. So with that, I now open the public hearing, and I'm handing this over to Director Ford.
Thank you. Good morning, Chair Bass, members of the Board of Supervisors. John Ford with the Planning and Building Department. Joining me this morning is Tricia Shortridge and Cliff Johnson to present the appeal of Jerry Maguire of the Planning Commission's denial of a coastal development permit. Before Ms. Shortridge gives an overview of the project components, I just wanted to say this was initiated in response to a code enforcement action. Part of the action was to resolve the house that was constructed without permits. In order to get permits, it required the coastal development permit. So this action really will dictate what happens with the rest of the ability to work towards cleanup of the site. I'd be happy to answer any questions about that as time goes on, but now I'm going to ask Ms. Shortridge to present the request.
Welcome, Tricia.
Thank you, Director Ford and Chair Bass. And good morning, supervisors. Let me share my screen. Okay, does everybody see that all right?
Yep.
All right. So this appeal hearing is de novo, so your board will consider all the facts anew. The applicant takes issue with the process during the Planning Commission hearing, the information presented to the Planning Commission by staff, and the way staff reviewed the elements of the project and the outcome of that review. Staff does not find merit in the appeal because the coastal development permit cannot, in its current form, cannot be approved, and recommends the Board of Supervisors uphold the Planning Commission denial of the permit. So the application is for an after the fact coastal development permit to address unpermitted work, including demolition and partial reconstruction of a single family residence. This slide and the following slides will show your board exactly what is being asked for approval and why it cannot be approved. Here is a view of the front of the property. Picture was taken yesterday. I had the wrong date on March 22nd. This is what the front of the property looks like from across the street on West Avenue. Here's another view of the property from the corner of West and Central. And here is a view of the property from the rear. And one other picture showing what the property looks like from the front at a different angle off of West Avenue. So the parcel is located within an established residential neighborhood in Fields Landing and within the coastal zone and under the jurisdiction of the Humboldt Bay Area Plan. The zoning is single family residential with a minimum lot size of 5,000 square feet, and the size of the subject lot is considered to be legal non-conforming at approximately 3,600 feet. 3,600 square feet, excuse me. The proposed site plan shows a 60 by 60 dimension configuration of the lot, and it also shows a 1,700 square foot building footprint for which an unpermitted slab foundation was poured. The proposal is for a 0 setback in the rear. a 1 foot side yard setback on the Central Avenue side, and a 6.5 foot front setback off of West Avenue. The single family residential zoning requires corner lots to have a 10-foot rear setback, a 20-foot exterior side setback, and a 20-foot front yard setback. Also, the maximum lot coverage allowed in single family residential is 35% of the lot covered with structures. And this proposal is requesting approximately 47%. This has applied to field landing since 2016. It requires the living space of residences, new residences, to be located approved if there are existing code violations on the property. In 2019, our code enforcement unit obtained an inspection warrant to get into the property to investigate for potential violations. And the inspection discovered junk vehicles on the property. The property was inundated with solid waste. There was an uninhabitable structure due to lack of electrical and gas service. And there was also an incorrectly installed wood stove and propane water heater, which posed an immediate safety hazard. This slide essentially summarizes the claims in the appeal. And the first 3 bullet points are related to how the applicant was treated, the need for COVID-19 considerations in issuing permits, and also claims for neighborhood support of the project. So addressing the first bullet point, the Planning Commission agenda follows. To get even a little more detailed on that, the alleged complaint or claim was that the applicant had to wait a very long time before being heard at the public hearing, Planning Commission public hearing on February 4th. But the Planning Commission agenda is set following a very specific process and is not set according to who the applicant is. It is set according to the type of hearing it is, and this was a public hearing set forth accordingly on the agenda. The project was also noticed in accordance to the Humboldt County Code. That would be in response to the applicant's claim that they didn't have enough notice that this was going to public hearing. Additionally, in December of 2020, staff informed the applicant that revised elevations and a revised site plan was required to show compliance with the flood ordinance and the development standards of the single-family residential zoning, or the applicant could submit an application for a variance for reduced front, side, and rear yard setbacks. The representative was also informed that the proposed project would be heard by the Planning Commission due to the permit application becoming controversial. Staff and the representative agreed at that conversation that the revised drawings and a revised site plan or an application for a variance would be submitted by January 6th. None of this information came forth. On January 12th, staff sent the applicant's representative an email informing him that the staff report would recommend denial at the Planning Commission hearing. So to address the second bullet point about COVID-19, the The planning department has been open to the public ever since May 2020 when the lockdown was lifted for essential services. There is no need for any special considerations related to COVID in this permit. The third bullet point talks about how the field landing community is in support. However, there is no petition showing neighborhood support for this permit. And the neighboring property owners have contacted the planning division and the code enforcement unit expressing great concern about the status of this property. Also, the appellant references other nuisances around Fields Landing, and this is true. There are several other sites in Fields Landing that are currently being pursued by the code enforcement unit. But the next 3 slides will show the appellant's other property, which is located just down the street, that fits into this category. Here's a photo of the end of Central Avenue taken yesterday. Shows the applicant's belongings inside the public right-of-way. This is what the adjacent property looks like. This is one side of it, one side of the fence. It's basically an area to store what appears to be junk and debris. Here's the other side of that fence, and there are 3 vehicles in there. It looks like some car parts and a lot of other miscellaneous debris. And lastly, the appeal claims that everything was demolished and constructed with permits. So as mentioned previously, and in contrast to this claim, none of the work has been performed or undertaken with a valid permit or with any county inspections. The appellant also claims that the coastal permit is not needed for this development. However, demolition and reconstruction in the coastal zone is considered development, and this particular location does not warrant an exception to the requirement for a coastal development permit. The one claim, the last claim on the appeal is that the intersection is not dangerous. However, all projects, specifically on corner lots, are required to be in compliance with the Humboldt County Visibility Ordinance, which states that any natural or man-made object exceeding 3 feet in height, which blocks or impedes the vision, is not allowed. This includes things such as hedges, bushes, natural growth, buildings, structures, fences, signs, all of which are prohibited. As with all corner lots, the project is required to conform with the visibility instructions or obstructions. The visibility obstruction regulations. Sorry, that was a bit of a tongue twister for me. So in conclusion, denial of the proposed development and the appeal means that the current state of the property will not be allowed to continue. The recommendation for denial of the coastal permit is based on the facts associated with the case. None of these facts have been refuted, and they demonstrate why the structure must be removed and the property cleaned up. And the facts are that there is ongoing and serious code violations since 2004. The appellant submitted an application for coastal permit because this was one violation out of several. However, the other violations still exist to this day. The appellant claims demolition and reconstruction work was conducted with permits, yet there is no documentation to show this. The applicant has not provided information that demonstrates compliance with the development standards or the flood ordinance or the visibility ordinance. And the application for appeal, I'll add one quick thing. The application for appeal did not contain any information to indicate the review process, the hearing process, and the decision process is or was flawed, or for that matter, unfairly biased against the applicant. So upon denial of this coastal development permit, the abatement process can continue, as Director Ford said, and the property will be cleaned up. With that, I will conclude this hearing and take any questions. Thank you.
All right, thank you, Tricia. Director Ford, would you like us to hold questions till after public comment, or should we all ask our questions now?
If you have questions for staff, it'd be fine to ask them now,
Okay.
or we can answer them after public comment. Either way is fine.
All right. Does anyone have any questions at the moment for Director Ford or Tricia? All right, I don't see any questions. Okay, Supervisor Bohn.
I see the applicant on here, so, and I just, I appreciate Director Ford, Director Hamblin, Director Wall, since I've had discussions with them all on this project, so.
All right, thank you, Supervisor Bohn. I don't see any other questions, so I did want to give Mr. Maguire time to give us his thoughts and his take. And so, Mr. Maguire, I don't know if are you on video also or just on the phone? Oh, there you are. And you have someone helping with the technicalities too.
You want me to start?
Yeah. All right. So welcome, Mr. Maguire. We'll go to you now for your presentation to the board.
Thank you very much. First, I'd like to say the decisions I'm appealing were made without allowing proper time to submit any evidence.
Can you hear him?
Can you guys hear me okay?
Maybe a little. Can you speak up a little bit more?
Well, I'm appealing the decisions that were made because they didn't give me proper time to support any evidence submitting to that last meeting they had. It was like a 9:30 meeting. And that's when it ended, and they basically just denied me the opportunity to even respond. That's just a factual thing. I'd like to say that anything I am going to say is based on facts, even though that was a nice presentation you have. But to the contrary, I could discuss every one individually, every situation. Unfortunately, at this point, I think I've received unfair and discriminatory treatment and request an objective view of it to consider this matter with an open mind rather than having something already formed. All that I'm asking is to finish building a single-family home which I live in. It looks bad, the pictures look bad, but I was never able to complete the project. And I'm just asking for the permission to finish it. If I was allowed to finish this, rather than stopping me and coming up with different reasons why, these houses were they're pretty run down to start with. So also, if I was allowed to finish the project that I've got started with permits, all that stuff would be cleaned up. There'd be no mess down there. It'd be cleaned up very nice. It's just a matter of going forward with it. The plans that I started with, they were approved by the building department. They're planned by the planning department. They were all approved. And the footprint that I was rebuilding is the same footprint that I was allowed to start with. It was permitted. I have the stuff I submitted to you guys as the engineer approval. It was inspected, and the concrete work was done to the footprint that was originally agreed upon. The reconstruction of the building itself, the process goes where you put your foundation in, you get it approved or inspected, then you continue. Continuation has been altered because it's been stopped through different reasons. They go way back a couple of years now. The continuance of the construction will be, if approved, will be totally under the guise of the building department. Inspections, approval, anything they want done will be done. I mean, that's just the way I build, or anybody will build. The footprint that's there was the original structure, and it was all set up the same time period, and the work done with code enforcement basically being there once a week,
micromanaging my project as I went through it. He did tear down other houses, which allowed him, I felt, the authority to go ahead and micromanage the project here. Like I said, where I'm at is the picture looks horrible. There's this very small lot. They want to tear down the structure there. They're saying that the structure is not conforming to any kind of code. And I have to say that everything is to code. It just looks bad because the plastic and stuff is being set up there to stop the rain from coming into it. And it's been a long time. I mean, just the process of getting a coastal permit, the 3-month process has already been a year and a half just to come to this point. And prior to that, the building department and code enforcement have continued to start work, stop work. I'm not blaming anyone. It's my fault for not somehow getting this finished from the very beginning. But my permits were taken from me at the very beginning through reasons which I felt very, very unfair. If they weren't taken from me, which I requested, this project would have been finished 7 years ago. Now it's a matter of just let me, I'm asking, just let me finish this thing. It'll clean up the property. It'll be done in a shortened period of time. The neighborhood will be happy because rather than having an eyesore, it'll be a brand new looking structure, which is much better for the whole Phil's Landing. I do have a petition from the neighborhood, and it's all the adjoining properties that are saying they're approving this. They want me to continue. There's not one person that's ever made a complaint as far as they're telling me. You know, I'll submit this to you guys. I just didn't quite have the time to do it, but it'll be submitted to you. They're saying that this all work was done unpermitted. Unfortunately, that's not true. That this thing was permitted, it was approved, and then they changed it on me in the sense of why they took the first permit away. I'm not quite sure, because the code enforcement had direct involvement with me, and they were dealing with me directly, supervising as I went along with the whole project. Is there something I'm missing here? Like I said, I appreciate your time. And any of the things that you addressed there, these pictures look horrible. It's just like the end piece down there. The Bohn, that stuff there is an ongoing. I just started that again, cleaning up that whole lot. So therefore, you got to get that stuff out of there to continue cleaning up, which is under the guidelines of the code enforcement. I'm in total compliance with what they've asked me to do. Working basically, what they tell me to do something, I do it. The comment on like taking the stove and all this other stuff out of there. I'm a retired engineering contractor. I do this stuff for a living. I've done it since I've been 10 years old, and nothing I do is not to code. That's just a standard practice. If you're going to do something, it has to be to code. And like I said, the engineer shows the pictures of the plans. They say that I've torn down this whole building. The plans that were submitted are very clear. It shows you the continuance of this whole project as far as the amount of work to be done, the amount of work that has to be changed. And it's very clear in the sense that you approve these plans. If somebody made a mistake, give me the wrong permit or something, we could address that because at the time that permit was as the plans say. And the plans are very, very clear on what to be constructed. So I'm not quite sure why they keep saying all this stuff was not permitted because no one's listened to the point where it was permitted, it was approved and continued, and it was inspected. The structural wood stuff, that's the next phase of inspections, which I'm more than happy to work with. In fact, I like to work with them because they've already told me the building department prior to right now, the 5th or 6th different group of people saying how bad this is. They've told me that since the walls are still open, they're happy with that because they can go in there and nothing's covered up in a sense other than plastic keeping the water out. Like I said, I've complied with everything they've asked me to do in the sense of cleaning up. They say there's open sewage and stuff like that. That's not true. A lot of these things, they're made by opinions of, I feel that people are seeing things because they're such a mess. I mean, I lost my main primary home because of the code enforcement trying to follow their guidelines. So I went from a couple acres down to this little tiny lot and cleaning it up. There's no room to put stuff yet unless
they allow me to continue, then all of a sudden this little building will finish, be cleaned up. This whole place will be nice and tidy looking. It will conform to the all the residents around there. So I'm just asking if you just allow me to finish this, please. So, and I'll answer any questions you have too.
We'll ask you, if anyone wants to ask a question now, they can, but I think we can go out to public comment because I see only one hand there. So if the board's okay with that, I'd like to do that. Then we can come back and ask questions of Mr. Maguire and see if there's anything else he thought of that he wanted to share that is new information that he did not tell us already. So with that, we will open up the public comment portion of this meeting. We have one hand raised. And if you're the person who has the last 4 digits of 7991, press *6 to unmute, and you'll have 3 minutes to talk to the board. There you go. Welcome.
Hello. I apologize. I'm a little bit nervous. I wasn't going to speak, but I feel like it's really important that I do. I am the next door neighbor. And I would like to say for the record, Mr. Maguire did just state that he has a petition with all of the surrounding adjoining, I believe is the word he used, properties in full support of him, and we are absolutely not. It has been a nightmare for us living next to this. I have been down there for 12 years now, and over the 12 years, I have seen this property decline at an alarming rate. It has been a very stressful situation to live next to, and there are oftentimes vehicles and vessels all over the roadways and things blocking the pathways so that you cannot walk past them. For a long time, there were pallets on the second story that were dangerous and hanging over the road, or hanging over the sidewalk rather, that were extremely dangerous. And he had things hoarded against our fence line, our property line, for so long untouched for years that eventually just kept getting stacked and stacked on top of until it actually caused property damage. The fence line broke into our property. His hoarded materials of all different kinds, metal, viscous liquid, paint, all kinds of different things came through our fence line. Then my husband, he, of course apologized, was very kind about it, wanted to fix it. And my husband said, you can't come on our property until I'm home. He decided to come onto our property without permission while I was home alone. I am a disabled woman. I actually called the sheriff's office for support and they laughed at me in this regard. Sorry, I'm getting a little emotional. This has been a really difficult thing. And I just wanted to be made clear that we are very concerned about his health and his safety living in this environment. It is not safe. And there are no buildings on this property that are up to code. So the last thing he should be doing, in our opinion, is building another building. And we just want him to get some help. Yeah, that's it. Thank you.
Thank you for calling in. All right, I do not see any other hands up, so we will go back to the board. I would just ask first before Supervisor Bohn, Mr. Maguire, did you have anything you wanted to add that we have not already heard? That's a different, because I want to make sure that we've got the information you want us to have.
Yes, one thing I'd like to say is people don't realize that this property, it's in the state it is because I'm not allowed to clean it up at this point until I get these permits. The code enforcement people, as soon as I start something, they basically stop me. And like I said, my neighbors are, I sympathize with them. I do the best I can to stuff out of there. And the structure is totally up to code, for one. And I don't really spend much time down there because I take care of my elderly parents. And to clean up this whole mess, if they just allow it to continue, get this thing built, and within a month, that whole thing is cleaned up. And this problem would be solved as far as anybody worrying about anything.
All right. Well, thank you. Thank you for that. And looks like you have someone else with you at your house that wanted to say something in far as response here.
Well, I would just like to add something as far as like public comment. My name is Brittany Maguire. I'm his daughter.
Okay. Hold on. Go ahead.
So I know there's been a lot of violations in the past, and there's definitely depictions of nuisances and junkyardness of this property. My dad is currently in a situation to finish his project. He has the financial ability, he has the motivation, the physical stamina, and the support network behind him right now to finish this. If you guys give him an opportunity to see this through, that'd be great. What's the harm in seeing this? As far as my understanding is that it's an after the fact permit. Okay, so penalize him, fine him, make some revenue from the county. There's no variances. There's no setbacks. It's a dead end street in Fields Landing. It is a low density neighborhood. That intersection would not, as it is right now, completing the building would not further alter that intersection or the visibility of that intersection. It would be how it is now, which is a safe intersection right there. How many of the intersections in Fields Landing are on a dead end street. It's a low density neighborhood. And even though maybe that direct neighbor does not support it, my dad does have a signed petition with multiple names of neighbors within his radius supporting him in this action. There's no flood code, or there would be a flood code violation. Okay, so my dad will alter his plans to change that bottom floor or that bottom story of that house to be a non-livable space. He'll change it into a garage and make the upstairs a livable space for himself. That in and of itself, altering plans is much easier financially and physically than tearing down the complete structure and having to restart anew. So if you deny this project, you're forcing him to tear down what's been done. 60% of this work has been done to complete this house. So you're forcing him to tear it down. You're prolonging any images of nuisances or safety hazards and potentially putting him in a space where he wouldn't even physically or financially be able to start a new project. So what you would be approving is taking away any potential to live on this property. That's my dad's residential home. He is an elderly person. They're becoming older and needs a place to live. So seeing that restarting this from anew and redeveloping plans not only causes economic hardship on himself and for those helping to support him, but you're temporarily forcing him into homelessness, even though those you see it as inhospitable, but at least a roof overhead. And you're it'd be completely new construction. It'd be from starting completely anew. And I understand that maybe some of the contemporary allowances of properties. I'm not completely conversed in that, but House Church mentioned that lot coverage is only 35%. This would be 47%. The actual impact of this single dwelling, single property in Fields Landing to Humboldt County would be so small and so minimal compared to the impact it would be for my family and for my dad. You'd be allowing him to finish a place to live in. And yes, it does look kind of nasty, but like my dad said, he's in a place right now to be able to clean this up and finish it. So thank you very much for your guys' time and consideration.
All right, thank you, Ms. McGuire, for sharing that perspective. At this time, I'll go to the board who may have questions for the appellant or for our staff. So Supervisor Bohn, can you push unmute?
No, I can't. Yeah, this is hard for me because I've known Jerry for well over 50 years. Went to school with them. Know where he grew up. But again, I represent approximately 28,000 people, and this is the second most complained about structure I get. And it's been going on since 2004. So, and I was just down there the other day, and the end of the street's getting worse. And the neighbor that talked earlier, her husband and her, they've made numerous complaints. I just got complaints from the neighbor on the other side. I don't know who signed the petition, but we have to look out for fire safety. And Jerry says 60% of what he's got built meets code. I did not hear that from any of our planning officials, code enforcements, and the amount of complaints and the time that has been spent on this in code enforcement. And this hurts me because I like Jerry. Jerry's got his fingerprints in most of the concrete that's been poured in the last 50 years around Humboldt County. But this has just been, and what this has done is created a couple other places, I don't know if they're related, that are just as bad in Fields Landing when we're trying to recover areas and make renaissances on them, and then we get this. I mean, I don't know if you can build on what's there, and best thing is to start from square one and meet all the requirements. Yeah, this one little house does not constitute a life or death for all of Humboldt County, but the two immediate neighbors are up to here. And that's who calls me and a couple of the other neighbors across the street about all the vehicles and everything. So I'm having a real tough time, and I think this has been on our books since 2004. And when we were all a lot younger, and maybe should have followed the rules a little bit tighter. So this is a tough deal, but this has to be cleaned up. I mean, I don't see another 4 weeks, 6 weeks making a big difference. I see it making a bigger pile down the street. So, and then I think Mr. Ford could tell us on the amount of complaints we've had on this property recently and historically.
All right, thank you, Supervisor Bohn. And definitely we will go back to our plan. Not quite now, Mr. Maguire. I want to see you hear from the other supervisors, and if one of them has a question for you, that would be the best time to speak. Any supervisors have any questions for either staff or Mr. Maguire? All right, Supervisor Bushnell.
Thank you. Through the chair, my question is for Director Ford. So this property currently has been abated?
It's in the abatement process. It has not been abated. We've issued a notice to abate and a notice of violation.
So this appeal is directly just related to the appellant's request to build?
Yeah, there's a couple violations. As Ms. Shortridge mentioned, there is the material around the property that constitutes a nuisance because it's basically stockpiled solid waste. There may be hazardous materials, but then there's the building that is there without permits. And so part of the remedy for that would be to permit the building. And in order to permit the building, it would require approval of a coastal development permit first. And what we've attempted to do is outline the constraints to permitting this, to issuance of building permits on this building. Normally the floodplain prevention requirements would be taken care of through the building permit phase.
Okay.
Any other questions? All right. And I just, okay, I was making a comment, but go ahead, Supervisor Bohn.
Well, and I was, Mr. Ford, what are the level of complaints from Fields Landing on this? And is 60% of the structure that's built to code? I mean, it's because, I mean, we don't have setbacks, we don't have building materials. I know we've got some engineering calcs in here, but.
Well, through the chair, I would not put a number on how much of it is built to code or not. Frankly, we don't know that any of it is built to code. The thing that we did know and see was that the water heater and the heater were not only not built to code, but were actually hazards, and so required that those be immediately disconnected. One of the concerns that we have, and this is laid out in the staff report, is that there was a building permit that was issued to replace the foundation and remodel the house, which would mean lifting the house, redoing the foundation, putting the house back down on it. What ultimately ended up happening is the house was removed and the foundation was poured without having an inspection of what was actually put in place. So we don't even know, frankly, if the foundation has sufficient steel in it to support a house being built upon it. We've done no inspections. We have no idea what's actually there.
Supervisor Bushnell, do you have another question?
Thank you. Board Director Board, through the chair. There's nothing that has prevented Mr. Maguire from cleaning up surrounding the properties. Can I ask that?
Yeah, no, absolutely. That's part of the violation, and code enforcement would never, ever preclude somebody from responding to the notice of violation, notice to abate, by cleaning the site up. It's our understanding that the argument has been that the material that is stockpiled on the site will be used to construct the structure, and so that's why it's being retained there.
Thank you, Director Ford. Mr. McGuire, can I ask you a question, please?
Please do.
So I saw the pictures that were taken from yesterday, and there seems to be a lot of stuff there, which not all of that stuff seems to be, it would be building materials. So I'm curious, you have neighbors and people have a right to not live amongst that kind of stuff. I'm wondering, have you made any effort, or why haven't you cleaned up your properties?
Well, I respond to that is, I say 90% of that stuff is building material. 90% is building material that is there. It's a tiny little lot. There's no room for anything. That 90% of the stuff that's there is building material. There's 2x4s, siding. It's covered up. People don't understand that if my permits, if they would allow me to work, they've actually told, I had a lawyer talk to.
So I'm going to interrupt. I just was wondering about the cleanup. That's my question.
I don't have to span if you guys allow me to. They haven't allowed me to. They've stopped me.
Okay.
Moving forward to he is now as a support network. I'm his daughter. We have me and my brother are more than committed to moving forward with helping my dad, doing what we can and cleaning up, moving forward too. So it's not just my father alone. Support of his.
Did I say like the end lot? The end where they're saying it's us, oh, it's bad. That is cleaning up. You have to get the stuff out in order to clean it. And that boat, I mean, everything is licensed. That boat is licensed. It's a part of the cleanup process. And like I say, and I have it all cleaned up in a month. They've told me I can't do anything down there.
Well,
all right. Actually, and hold on, Supervisor Bushnell. And Mr. McGuire, fine to answer questions, but you probably don't need to go and repeat what you've told us earlier, just because it'll take longer for us to get to a discussion. So definitely, Supervisor Bushnell, if you have another question for Mr. McGuire.
No, thank you, Chair Bass. That was my only question.
Okay, thank you. I had actually had some couple questions. I mean, well, first of all, I know the line of sight doesn't make sense to a lot of people, but I do know how I had a whole entire neighborhood that kind of had to go through that. So it is important, even if it may not seem like it. It really is. I have my main concern, or my only concern, actually, because I, in general, support staff's suggestion or recommendation, but I do worry about someone becoming homeless. I guess my question would be, what are the options for that site? I mean, if the building comes down and is taken down, is that site something where a trailer can be located or something? I just, I know there's ways for people to work through this, and I'm glad he's got the family to help him probably find a place, but just curious, is there anything that can happen on that property that would eventually be a place where a human could live that we have any path for.
Yeah. In response to your question, Chair Bass, yes, that site can be built upon. It will require some considerations in terms of setbacks, although it is a substandard site, and so there may be some opportunities to grant a variance or something there. A tiny home or something like that could be placed on the site. It would need to be anchored and elevated in such a way that it would not be washed away during a flood, but that there are options there.
But, okay, all right. Thank you, Director Ford. Supervisor Wilson?
Yeah, I just want to say that it seems to be very long-standing, and I do support staff's recommendation, although I would say that I am definitely someone who is appreciative of the concept of variances. I do understand and I do believe that elevations are going to be really important in this location. I just have to say, like, even if this was to move past us, it seems like something that would likely be appealed to the Coastal Commission, and I can't imagine it getting very far in that respect, just because of where that is going with relationship to sea level rise and those other issues. Yeah, I mean, and in terms of like density in these spaces, and I want to say about this particular intersection, I actually was in an accident on this particular intersection. So I was broadsided some years ago. It was as I was going down from someone who was speeding down the street there. So it does have issues with relationship to visibility. I've witnessed it myself. Nonetheless, I do think that there is a need for a kind of a start over in terms of permitting this space. There seems to be just too much drag on it with relationship to what's happened in the past. And so if Supervisor Bohn is going to make the motion, I'm willing to second that.
What motion?
I'm hearing the motion would be staff recommendation, but yes, Supervisor Bohn, and then I don't know.
If we go to staff's recommendation, he has to clean the site up, because, and Jerry, I'm trying to bend, but I've got the other neighbors just chewing on me like no tomorrow, and they have been, and I've had the director of public works down there no less than 6 times. No less than 6 times. And I've called there, I don't know how many times you and I have talked inside. I was down there the other day and you were tearing pallets apart for more building materials, which I don't know are building materials. So hang on. And I would love, I mean, there's down in the other lot where the backhoe, the licensed boat, that thing will never, I mean, the boat, you've got 3 vehicles down there that aren't licensed. They're licensed, but not currently. And like most other people, what they do is if they have the benefit of another lot, they would have all their building materials down there ready for what they're doing. But the neighbors are so worried about fire because their houses are going down if you catch on fire. I mean, it's just leaving a dangerous situation. And my thing is staff recommendations, let's everything come down and then start over from square one. And if you do that, you can take everything apart, get it all stationed, and then come back and apply. But it's just the neighbors have been appealing, and this has been going on since 2004. So it can't be all the building and planning's department. I know Ms. Shortridge has spent numerous amounts of time. I know how much time Director Ford, and there's 2 other places down there. I know you feel being picked on, but there's 2 other places that are going to happen in the next 6 weeks, or I'm going to go nuts with people calling me, because this is getting out of hand, and we all have these places in our districts, but it's the property values, the people next door to you. He works out of town. He's worried about his wife if it catches on fire. The people next door to you have kept those 2 rental units up nice, but they are up in arms, and I have to consider their values and their problems too, because she said she would sell her properties, but nobody would buy them with what's next door to them. And this is and you have to admit it's not very appealing. And Brittany, I appreciate you and your brother stepping up and helping pop out, but this should have been done 5 years ago, 7 years ago, maybe even 17 years ago in 2004 when this all started, and we may not have got this far.
Code enforcement has stopped.
Actually, Mr. McGuire, I'm going to give you a couple of minutes after the board is finished asking our questions and talking, unless it's a specific question for you. But then I will give you a couple minutes to wrap up your final thoughts and requests on the board. Supervisor Bushnell?
Thank you. Through the chair, my question is for Dr. Ford again. So if we deny this appeal, will the abatements go forward and will require cleanup?
Yes.
And so if he doesn't clean up, then the county will?
Yes.
And then how long will he have to clean up once he's issued that notice? How long will he have to clean up?
So I should have anticipated that question. Gonna probably try to meet with him. If in the event the board adopts staff's recommendation, our first step will be to talk to him to find out what his plans are, and then we will go from there. We will give him a short amount of time if he wants to do it himself. Otherwise, we will do it. And it's going to be somewhere less than 30 days.
So if we do it, then we would be issuing him a bill for the cleanup, correct?
Correct.
Okay, so our first attempt though will be to work with him to try to get the situation fixed, right? With his input.
Yes, that is what we have been doing. That is our standard pattern of operation. That's what we will do one final time. And then if that doesn't result in a satisfactory response, we will clean it up.
Okay, thank you.
All right. So thank you. Anything else from the board? I can also take a motion. I know Supervisor Wilson had said he'd second a motion, but I need a first.
I'll make a motion for staff's recommendation. I don't do it lightly, but it's gone too long. I do appreciate staff going down to meet with him. And if staff goes down there and there's a revelation that goes, oh my God, it's almost there and it's perfect, I'd expect you to come back. But if I don't think we're going to see that. So
okay, there's second. Since we got into the conversation, a second, because I know there's. Thank you, Supervisor Bohn. And I do have one more question before we go to Mr. McGuire. I had mentioned the homeless aspect, which is I find very concerning. So can we also, I don't know if we have any services through Health and Human Services, or if perhaps he has something that he can qualify for, whether it's through veterans or one of our others. Can we try to, I'd like to see an opportunity to help work with the temporary living situation that he may find himself in. And I know that's not part of your job, Director Ford. I'm just stating that I would really like to see some follow-up on that if possible. And I don't know what that actually looks like. And I believe Supervisor Bushnell was also kind of concerned about, does he have somewhere to go? So I hear you see your hand up now, Supervisor Bushnell.
So I am obviously the area is concerning, but I am also, the whole thing actually breaks my heart because I am concerned that our actions will result in him being homeless. And so that's very hard for me. And I I think, and I really am sympathetic with the neighbors because it's not pleasant either. And so the whole situation is just very hard for me. And I do recognize that probably he has been given quite a bit of time. And so that is something else that, I need to consider. But I would like to have a path that we could at least help him, which Director Ford had said, that would be what they would do first. So that makes me somewhat comforted. But I just am very torn about, what we're going to do is going to result in him being homeless. And that's hard for me.
Director Ford, do you have any thoughts that you can convey regarding the issue that we've just brought up?
So we will do everything within our capacity to find aid, grants, resources, alternative housing to make sure that that concern is addressed.
Great, thank you. I just wanted to say I'm glad that his family is there to be the support system. I just think support's going to look a little bit different than what they were hoping, but it's good to have them here, and perhaps things will get cleaned up more quickly with them involved and such. So I will give Mr. Maguire or his daughter an opportunity. You got like maybe 2 minutes to make any final comments that you would like to make.
I'd like to make comments. To begin with, this is not real. Everybody doesn't want to take any blame for what the actions they've taken, except for I'm the one that did everything wrong. I've been waiting to finish this project for almost 7 years, and it's been stopped by the agencies dealing with it. They just want to keep passing it on to this point here where they finally get somebody to say, tear it down. Does clean up mean tear it down? It was built to code. It is built to code. Some of these people need to come down and look at this because it looks ugly because they won't let me do anything. Tricia told my lawyer the other day, I cannot even do anything down there until this is resolved. That means even cleaning up. That means taking the plastic off the walls. This thing is not as bad as it looks. It's just ugly because it's been stapled, it's been stopped, and even clean up down there. Before you guys vote on this thing, I would really like somebody to come down there and let me show them what this thing really is.
All right, thank you for those closing comments. And I'll give your daughter you only use 1 minute. So Brittany, you're kind of hearing where this is going, and
I think that something else is to consider is that the money that it would cost to tear everything down, and to restart, that's in my mind would be like a huge amount of money. And 30 days to clean up 2 lots, understanding that we also work jobs and have other obligations. It does take time, and every project looks a little messy until it's completed. And it just money that's been is a lot, and it would take a lot to tear everything down, restart, get new plans developed, and everything moving forward.
Give me a month to clean it up.
all right, thanks.
They compromise, give some time, give him 30 days, see what he does in 30 days, and then make a decision going forward after that. I feel like compromise would be the way I would go.
All right, well, and thank you. So now we will decide where to go from here. But the part about cost, and it's totally understandable. But when we're making decisions, we have to consider a whole lot of things, and cost not necessarily being the top of that list, I don't believe. All right, so Director Ford, in the 30-day thing that you 30-day thing in working with them, if there is some inkling that you're getting that things are moving and there is an opportunity to salvage anything, is there any way that can happen? I'm hearing his daughter ask for time, but I think I think we need to finish this today, what we're talking about, and and then I suppose it could come back to us. But do you see any path that she was requesting?
So I will offer this. One of the concepts that we can move ahead with is if we can sit down and have a meaningful dialogue, perhaps enter into a compliance agreement to get everything else cleaned up. And then take a look at the house. The struggle is, as Supervisor Wilson mentioned, is that the house is in a very bad location relative to flooding, and we really didn't even get into sea level rise in addition to that. So, unfortunately, we're in a really unfortunate place here. Nobody likes this, but the fact of the matter is that if the approval of this structure in its current condition places it in a location where people would be subject to flooding.
Yep.
And
right.
maybe there's something else that can be worked out, and if we can work that out with the applicant, we will do that. We'll come back to the Planning Commission with a different CDP. We'll work with the applicant to make that efficient. But right now, the applicant has not presented any plans or ideas formally to us that would address the concerns. If that changes, we will absolutely work with them.
All right. Thank you very much for that clarification. And actually, we're done with, I think okay. One quick response. I think, Brittany, are you the one that turned on the microphone?
So, I mean, if my dad if he kept the same structure, but turned the bottom floor into a storage or a garage, that's non-livable space, that's above 9 feet above the ground, would not, the flooding issue would not be an issue then.
All right. Well, that's a conversation that we're not going to have here in this forum. I think what I'm hearing as we move forward with this vote, and then Director Ford will be willing to listen to ideas, thoughts, and consideration. And I believe if he feels that there is something possible to do, that it will come back to us. So that would be my suggestion, is someone really work closely with us in this, with Director Ford. It's the best path you're going to have to anything, I think. So we have a motion, we have a second. Supervisor Bohn.
And this is Director Ford. So even though it's not named in this, and because it's become the outlier, the property at the end of the street that is on the wetlands, the tidal influence lands, with the 3 vehicles and everything else, are we gonna allow everything to be taken down there? Or are we gonna make that be cleaned up before we start piling everything on top of the vehicles and stuff? Is there an avenue we're gonna do there, even though this isn't mentioned in there? If we're quote unquote going to work with him, then I think this has to be a 2-way street, because
So requisite to any discussions about the house, start with all the sites, including the things in the street, being removed and being cleaned up. There is no discussion about the house until everything else is cleaned up.
All right, thank you.
All right. Well, at this moment, I think, Brian, will you please do a roll call vote on the motion?
Yes, thank you, Chair. Supervisor Madrone?
Yes.
Supervisor Wilson?
Yes.
Supervisor Bushnell?
Yes.
Supervisor Bohn?
Yes.
And Supervisor Bass?
Yes.
Thank you. Passes 5-0.
All right, so this public hearing is now closed. And we will move on. We actually have a lunch break today. Wow. And so our closed session item is 2:00. So because it's time set, I'll see everybody back here then.
Chair?
Yes. Yes, sir.
We actually have 2 other closed sessions that aren't time set. I don't know if you.
Thank you. No, I'm sorry. I just have my I was wrong. I've been wrong before. I thought so. Alrighty then. You don't get lunch this early. County Council Billingsley, will you brief us on what we're going in for?
Yes, thank you, Chair. It's the intention of the board to meet in closed session on 2 items at this point in time. The first is to consider a public employee appointment for the position of public defender pursuant to Government Code 54957. The second, it was conference with legal counsel regarding anticipated litigation, initiation of litigation pursuant to paragraph 4, subdivision D of section 54969.9 in one potential case.
All right, thank you. And let's see if there's any public. Supervisor Wilson?
Oh, just a clarification. Can we report out after the 2 o'clock closed session? Is that okay? Or do we need to report out directly after this that we're about to go into? This is a question
Yes,
for
County Counsel.
It would probably make sense to just report out at 2 o'clock before we go back in on the time certain.
Okay, thank you.
All right, I'll open this up to see if there's any public who wants to comment. And that would be no. And again, I do apologize for trying to skip that. Like I said, I make at least one mistake today, and that's not going to be my first or last. So, all right, we will go into closed session at this time. And we'll just go straight there. That's fine with everybody? Okay. All righty. All right. We are back and we're going to start. And we're going into 2 o'clock. I've got a echo. Anyway, we were ready to go into our 2 o'clock time set closed session item. So, Mr. Billingsley, can you please provide a report? And I'm not sure why I'm hearing echoes, but I apologize.
Thank you, Chair. First, I wanted to give the report out on item M2. The board voted 4-1 to authorize county payment under protest of past due and current utility payments for 929 Foster Street to ensure continuity of critical county operations. Item M1 is still under consideration, and the board is now going into closed session on item L1, conference with labor negotiator pursuant to Government Code 54957.6 to meet with and review the county's position and instruct its labor negotiators, Kelly Barnes, Alicia Hayes, and Jack Hughes, for the various employee organizations listed in the agenda.
All right, thank you. I'll ask if there's anyone who cares to make public comment on this time. And there appears to be nobody who wants to do that. So we will once again adjourn to closed session and report out after we're done. And do you have a time frame for that, Council Billingsley? I can hear you better if you unmute.
Half an hour to an hour, I'm not really sure how.
Okay. Well, I'm not going to give a definite time then, so we will see you in that room. Do we have a report out of closed session?
Yes, Chair. On items L1 and M1, there's no reportable action.
All right, thank you. And with that, we're adjourned.